for joining. I'm taking attendance as we do this. We already have a quorum.
Don't worry about attendance, Mark. We can do that for you.
Okay. Okay. Sorry.
Oh, Mark, you didn't change your name from a Manhattan.
Oh, thank you.
We're up to 28 members of the public. So that's
Excellent.
great to see, and it's still climbing.
Okay. So let's see who's here in the way of attendees. Welcome all attendees. To make sure that everybody can hear me, especially among attendees, please find on your screen, I think you have to click on participants, the way in which you can virtually raise your hand. It should be a little raise your hand either icon or, I'm sorry, this is just for attendees, not for my board colleagues. If everybody could find that and go ahead and try and do it, please. I'm seeing a bunch, okay. I'm not sure how to do it on the phone, so if Rich or anybody knows how to do that, chime in.
I don't know how to raise hands on the phone.
Yeah.
I can look that up, but I'm not sure. We only have 2 phone callers.
Okay, well, that's good news. I've got 3, but okay.
We have a virtual hand wave, which is a good way to kick things off.
Very good.
We get started?
Why don't we get started? So welcome to the April virtual full board meeting. Thank you all for attending. A couple of ground rules, and I'll call on my, first I want to thank my co-hosts for tonight, which are Rich, Andrew, and Doug, Andrew Ridgie and Doug Kleiman, who will be assisting in the operation of this. Any errors in which of the facility or the way in which this plays out are entirely my not being familiar with this format. So please direct those comments to me and thank the co-hosts for their joining in on this. I'll do some more thank yous later. The way we're going to run this meeting is a little bit different than in past, in deference to the desire to focus on our work with a particular focus on the crisis we find ourselves in and the reason why we're meeting virtually instead of in person. As a result, there will be no chair's report tonight. In lieu of chair's report, we're going to hear from folks who are working on the current crisis and working on the response to the next crisis. So, but we're also going to be hearing from elected officials, as is our usual practice. When an elected official joins the call or joins the meeting, we will pause for a moment to hear from them and then bounce back to our usual content. The chair's report, or the in lieu of chair's report, will be consist of the West Side Campaign Against Hunger, and Erica Freud is with us. I believe I saw you on the call. And then let me see if I've got anybody.
I just unmuted Erica.
Thank you. Anna Schatz is with us. She's from the Office of Emergency Management. Thank you for joining us. We'll hear from her. At that time, I will also read a statement from our precincts who are unable to be with us, but is, I think, relevant to what Anna will be sharing with us. We will also be hearing from the Community Education Council on their efforts with respect to remote learning. Let me see. Yeah, and then we'll be hearing from a couple of representatives of the census the census is how we avoid being unprepared next time more than it is responding to this crisis. But that's how we're going to move this along. I understood that, so it's, well, it's 6:35. I believe Speaker Johnson is going to be joining us at 6:40. And I'm scrolling through to try to find Speaker Johnson on my list here. I don't see him. I see Senator Hoylman is with us. And if, and as long as I'm not, okay. So I'm going to call on Senator Hoylman, and I believe I've just unmuted you. Senator Hoylman, welcome to Community Board 7 virtually.
Hi. Thanks for having me. Good to see everyone virtually. Jacob is on the phone with me. I think everyone knows Jacob Farley. Wave, Jacob, yes, virtual or otherwise. I mean, I just, first of all, want to thank everyone here for their resilience and support of our neighbors. It means the world to our community that we are pulling together through this incredibly difficult time. We know that, the numbers were grim today that the governor released, but we have to focus on the fact that we are, according to many modelers of this pandemic, reaching the apex. Social distancing is working. Staying at home is working. Wearing masks outside is working. I want to just continue to offer my office as a resource. We've been getting more constituent emails and telephone calls, Jacob can attest to, than ever. Our entire staff, all 12 of us, is absolutely committed to constituent services. We have been doing some other things, as I think you may have read about last week. We passed the $177 billion budget. There was a lot of gloom in that budget, a few bright spots. Mainly, I wanted to mention the fact that we were able to basically inject, a $7 billion lifeline into the budget for another number of human services projects. We've increased funding for unemployment insurance and for sick leave. Hospitals were facing tremendous cuts, $60 million worth of cuts in the governor's initial budget that were being confronted by hospitals in our Senate district alone. We fought that back and saved $200 million worth of those cuts. And we've also were able to keep education funding at the same level as last year. That's not a win, but in this kind of pandemic environment, I guess, it is considered that. So I'll mention a couple of bills that I was able to keep in the final budget that I've been working on with Assemblymember Linda Rosenthal. She and I have sponsored a ban on flavored e-cigarettes throughout the state. That was included in the budget. That's very important when it comes to respiratory conditions. And we know there's some suggestion now that vaping and of course smoking are correlated to poor outcomes for individuals who have COVID-19. I passed legislation that would protect survivors of domestic abuse. Now, when a police officer goes to a home and a domestic dispute and weapons are found, the officer can take those weapons for 48 hours for a cooling off period. And again, not only in domestic violence disputes are weapons often used. Statistically, they show that women are killed disproportionately in those types of situations. But now with COVID-19 and self-quarantining, rates of domestic violence are ticking upward. And then finally, one bright spot I would have to say is a bill that I've sponsored for years to legalize surrogacy contracts in the state of New York. New York was only one of 3 states that had outlawed it. My husband and I had our 2 children, Lucy and Sylvia, through surrogacy, but we had to travel 3,000 miles to California to do it. So we now will be able to do that in the state of New York. And we have the strongest protections for surrogates, donors, and intended parents in the country, and I would argue the entire world. And then finally today I introduced a bill because we're still legislating, we're still in session. So everything that you didn't like the budget and policy, we can hopefully fix. And I know many people are disappointed that there was a rollback on bail, and I share that disappointment. But I hope we can address that issue. The new bail law does not go into effect for 90 days, and it requires specific reporting around racial bias, which is going to be very important. But the legislation that I referred to earlier today is a full moratorium on evictions during the health emergency. The governor did issue a declaration to his executive powers preventing landlords from physically evicting tenants during the state of emergency. The problem or the shortcoming, although I appreciate his efforts with that moratorium, is that once the courts are open, landlords can pursue evictions on paper. And so the date that this eviction current moratorium is set to end is June 18th, 2020. So you could see on June 18th, landlords actually attempting to physically evict tenants. And that, of course, is not fair, given the fact that so many people are fighting for their health and their family's health. So many people unemployed, the tens of thousands of unemployment applications are just overwhelming. The Department of Labor's website has basically crashed because of a result of that. So we're going to give them a safe harbor, what we're calling it. The New York State Tenant Safe Harbor Act, give them 6 months to pay their rent, to get their health in order, and hopefully find employment. So that's the bill that I introduced with Senator Krueger, and I hope to, hope you guys can take a look at that. And then finally, if you do have issues, concerns, neighbors who need help, let us know. Let me know personally. I think my email is bradhoylman@gmail.com. Shoot me an email or reach out to Jacob. We've done things like move face masks across the Mexican border, believe it or not, because a constituent called us and needed contact with the FDA to do that. We've delivered face masks to Bellevue Hospital and to Ryan Chelsea Clinton, the Community Health Center. So we're on the ground trying to do what we can while remaining a safe distance and following the protocols that have been set forward by the governor. But I also want to thank my colleagues on the West Side who have been tremendous resources. Assemblymember Linda Rosenthal and I have had a town hall every Sunday. I hope some of you have been tuning in. It's been very interesting and informative. We're going to continue to do that. And of course, Congressman Nadler, Councilmember Rosenthal, the speaker. It's been a united effort along with Assemblymember Gottfried. So thank you, everyone, and stay safe. And please reach out if I can be of assistance.
Thank you so much, Senator. I thought we had Corey Johnson on the line, and I don't see him now. If I'm going to unmute all for a second.
Mark, I just unmuted Andrew from City Hall. Is that?
City Hall? Is that? I'm sorry. Go ahead and unmute, Doug. I don't see it. No, Andrew Kunkes is the mayor's office of the mayor's office. That's different.
He's on.
All right. Shoot. I'm doing my best here, guys. Hang in there with me. Let's see. I see Mark Levine, so I'm going to unmute Mark and invite him to speak. Welcome to Community Board 7. I thought the speaker, Speaker Johnson, had joined us, so I apologize if he's on the line and I can't hear him. So I think I just unmuted Mark Levine. Please go ahead. Welcome to our meeting.
Well, thank you, Mr. Chair, and hello to everyone on Community Board 7. I hope everyone is staying safe. You probably don't need me to tell you that this has been the toughest week yet in our battle against this virus. When I talk to folks in emergency departments, they almost all use the same language to describe what they're experiencing. They call it a war zone. And even some folks who have actually served in war zones are saying this is as bad or worse. It's really rough in our hospitals right now. But there's actually some good news. We can start to see early signs that the work all of you are doing as leaders, as New Yorkers, to promote social distancing is actually beginning to yield some benefits. The rate of new hospitalizations is not increasing as fast, and many believe that might actually mean we're close to the apex. That could be days away, but there's still more people being admitted to hospitals than are being discharged. So the situation there is still extremely tense. And some of you have caught the news on the number of deaths that have spiked just in the last day. And of course, that's a lagging indicator, and then the more positive news on hospitalizations might indicate that we're heading into better territory. I sure hope this doesn't mean that New Yorkers pull back on social distancing and staying at home and all the important actions that you've been taking. Just like it's taken us a while to get to this apex, it's going to take us a while to climb down from it. Probably weeks and possibly months, in which we will see the numbers in hospital declining, and that's a relief, but still a lot of people extremely sick and extremely difficult conditions in our hospitals. And it's why I've joined with all of you, continuing to fight really hard for the equipment, the supplies, the personnel that our hospitals need. And it's not just hospitals, it's senior centers and nursing homes and long-term care facilities that also are serving many patients with coronavirus and are desperately short of protective gear, staff that's been pushed to the edge, and in desperate need of assistance. Some of you who watch the data and have watched the news have seen some really disturbing trends on just who's being affected disproportionately by this virus. And while it's true that coronavirus doesn't discriminate, it is also true that because of profound inequality, racial inequality in our society, that this is disproportionately impacting low-income communities and people of color in our city and nationally, because of crowded housing conditions, which make it easier for the virus to spread, because of the fact that low-income people are less likely to be able to telecommute and more likely to be out there serving us in jobs that are essential now, but put them at risk in public. And most of all, because of unequal access to healthcare from since before this pandemic, and the unequal health conditions that have emerged. We have seen data from other states, from Michigan, from Milwaukee, from Chicago, that shows quite starkly disproportionate impact on people of color. We haven't seen that data in New York, and that's a problem, that we still don't have that data. We still don't even have data based on zip code for anything up but test results, which is really the least meaningful. We need data on deaths and hospitalizations based on zip code, based on race, if possible by income, disability status, so that we have the true picture of the inequality which is both being reflected in this pandemic and unfortunately exacerbated. And lastly, I'll say a point that you've heard me articulate in the past, but which remains true, that really every part of our healthcare system has to be preserved for people who are extremely sick. And in the context of coronavirus, that's really people who are in respiratory failure. And that's about 20% of those who get the disease. For the other 80%, we need to, and the good news is we can simply heal at home. And I have personal experience with this. Some of you know I've been through this, and I'm doing great. I was able to rest at home. I didn't need medical care, and that is going to be the experience of most of you. And so I'd say the short version is that if you have a fever, even a high fever, and the typical dry cough, and you're otherwise healthy, you don't need medical attention. You need to rest, you need to hydrate, take over-the-counter medication for your fever, for your cough, and be prepared to call a doctor. If you don't start to get better after 3 or 4 days, if your situation worsens, such as difficulty breathing, when do you call 911? When do you have to go to the ER? Well, only if it's a true emergency, because the EMS system is also overburdened right now. And in the context of coronavirus, that's severe difficulty breathing, chest pain, loss of consciousness. Those emergencies require a 911 call. They require getting to the ER. But you don't want to call for 911 if you simply are dealing with the fever. So that's it for me with the update.
Thank you so much,
Thank you for this
Council Member.
opportunity.
Thank you so much,
And I
Council
wish
Member.
everyone to be safe.
Councilmember, thank you so much. I've got Congressman Nadler on the line, so I'm going to recognize him. But if you have a quick answer to a question I just received,
Yes,
you
sure.
may, folks on the call may see me looking to my left from time to time. There are people trying to log in with troubles and that, so I'm not ignoring your call. I'm
Okay.
trying to make sure other people's join.
Yep.
The question
That's
that I received was, why don't we have demographic data in New York? Is it that we're not counting it, or that they're not releasing it, or some other thing?
Well, you know, the test results are done by mostly private labs now, and that's been, you know, I don't know if they're collecting it adequately. But you know what's on the city is to get us data on deaths and hospitalizations.
Okay.
And there's really no excuse that they haven't produced it. They claim it's coming soon. This should have been built before this pandemic. And you and us, we have to keep agitating for it. We need to know this information, and we're going to keep pushing until we get it.
All righty. Thank you. Thank you so much, Council
Thank you,
Member.
Mr. Chair.
And thank you. And we hope you are fully recovered by the next time we talk.
Thank you. And shout out to Congressman Member Nadler, who's been an amazing leader in this crisis. And of course, to the previous speaker, my friend and our great state senator, Brad Hoylman. Thanks to everyone.
Thank you, Council Member. I've just unmuted Congressman Gerald Nadler. I don't think we have a video for you, but please welcome to Community Board 7 and please please go forward.
Well, it's good to see a lot of you. I know some of my colleagues are going through many of the details of what's happening. So I want to start by saying I hope everyone is healthy and taking precautions to keep themselves that way. We will make it through this crisis together. Now, my office is teleworking and is fully functional. And if we can be of assistance, do not hesitate to reach out to us. Last month, a few weeks ago, the House passed the Bipartisan CARES Act. This is the third bill we passed, the next phase of our COVID-19 response. While this was certainly not the last effort to tackle the enormous economic, health, and budget issues caused by the pandemic, and I'm sure we'll have more, it took important emergency steps to respond to the needs of working Americans, to support those who have lost their jobs, and to provide for the hospitals and healthcare workers on the front lines of this crisis. The bill provided a lot of very remarkable measures to meet the challenge of this moment. And although that's true, we still have a lot more to do. I just want to outline some of the key things it did. It provided a lot of funding for New York State and the city, not enough to cover the costs, but you have to realize a lot of these figures are taken out of the air. What might they be? So we'll have to add to them. It provided something I have long supported, which is direct cash payments to help people get through the economic crisis. $1,200 automatic one-time payment to each individual earning under $100,000. Now, we fought to increase this from the original suggestion of $600, which we did. We doubled it. It's not going to be enough if this crisis goes on for a while. We'll have to add to it, but it's a direct $1,200 payment for every individual period. We have a short moratorium on evictions for federally subsidized homes and for foreclosures for federally backed mortgages. These cover about half the housing market. I am hopeful in the next bill we can get the moratorium to include everybody, not just with those with federally subsidized homes or federally backed mortgages. But this is a giant step in the right direction to start with. For the millions of Americans who've lost their jobs because of the virus, the bill provides $600 a week in unemployment compensation, in addition to whatever the normal unemployment provides. Now, $600 a week is a lot of money compared to normal unemployment compensation. Um, we also made major progress. One of the problems with unemployment compensation is that it doesn't cover a lot of employees, such as contract employees, gig workers, freelance workers, furloughed workers. We got most of those into this bill, so that even gig workers, contract workers, furloughed workers will be able to collect the $600 a week unemployment insurance. My concern is not that it isn't enough money right away, because it is for the moment, but my concern is that it will take a while for the dispersing agencies to ramp up bureaucratically to be able to get this money out the door because of the huge volume of claims. But we're working on that too. The bill provides $4 billion to prevent homelessness and to help public housing agencies. It's specifically directed in New York at NYCHA, the housing authority, to stay afloat. We provided that all student borrowers will be allowed to defer all payments, interest, and principal for student loans through September. We may have to extend that. I suspect we will. But at the moment, all payments, interest, and principal for student loans are suspended. For small business owners and nonprofits, the bill provides $350 billion in loan forgiveness grants for small businesses and nonprofits to pay their rent and other costs as long as they maintain their workforce. If they don't lay off their workers, we're providing all this money to help them do that. We provided $10 billion in emergency grants of $10,000 each for immediate relief of operating costs for small businesses. We provided $25 billion for transit authorities, including specifically $4 billion for the MTA here in New York, as well as additional funding for the Port Authority, Amtrak, and other critical transportation infrastructure in this area. Perhaps most importantly for New York, the bill includes a Marshall Plan for hospitals, providing $100 billion in funding directly to hospitals to reimburse the massive costs of responding to the epidemic. I know that many Upper West Side residents have reached out to our office with a variety of concerns, including getting through to the state unemployment office, whether they qualify for pandemic unemployment assistance, mail service interruptions by the post office, funding and resources available for small businesses, and whether they'll be able to get a tax rebate. My office has the resources, and our staff can help answer specific questions on the programs outlined in the CARES Act that I just mentioned and other constituent concerns. So if you have any specific questions, reach out and share what is working or not with the programs outlined. As the administration sets up these programs, we're encountering lots of implementation problems, and sharing your issues will help us find ways to fix them. We have a dedicated section on my website, and that is nadler.house.gov, which has every resource we can find. And I've released guides for unemployment and small businesses. We'll continue updating the website with new information and resources as they become available. This website, nadler.house.gov, is also the best place for constituents to contact my office regarding any problems or concerns or any way we can be of help. I don't want to take up too much of your time, so I'll leave it here. Please do not hesitate to reach out to my office if we can be of assistance. Thank you. I look forward to seeing you again soon. And if there are any questions, I'll be happy to answer them.
I have to unmute myself here. Thank you, Congressman. Thank you so much for that detail as well. There are a couple of questions, but we also have the Speaker of the City Council on the line. So I'm going to take one of the questions that I already received, which is, with the firing of the Inspector General, who's going to be making sure that all the money that you allocate appropriately in Congress goes where it's supposed to go?
Well, with this administration, that's always a problem. They appointed a new Inspector General who is an administration loyalist. And I suppose the answer is going to be that Congress is going to have to stay on top of it. Our committees are going to have to be watching it as best we can.
Well, thank God that we have somebody with your stature and intelligence on the Judiciary Committee. I see a lot of clapping hands among my colleagues. So I'm going to leave it there. I'm going to thank you for joining us remotely, and I'm going to try to unmute the Speaker of the City Council, Corey Johnson. Speaker Johnson, welcome to Community Board 7. Can you hear me, and can you take it away?
Hey, Mark, thank you for doing this. It's so good to see Congressman Nadler, who is the best, and we are so grateful and lucky to have. I'll try to keep this quick, and I apologize if I say something that other folks have said. I was just on the phone with Senator Schumer, which is why I was late, talking about many of the great things that Congressman Nadler was just discussing. So here's just my quick update on, I think, the three things that we're trying to do simultaneously right now, collectively as a city, both as individual New Yorkers and as folks that are in government. Number two, continuing to halt transmission, flatten the curve so that we ease up on the hospital system and the healthcare heroes that are doing that work every single day. While simultaneously you've seen the increasing of hospital beds and the increasing of building hospital capacity all over New York City. The numbers over the last few days, it's hard to actually fully know what's going on, but I hope, as the governor said, we are in a plateau because we need to start to come down slope on infections and on hospitalizations and on deaths. So we need to increase that hospital capacity until we get through this. The third thing, which is what Jerry was just talking about, and we're having these conversations every single day at the city council, is figuring out how to provide economic relief to New Yorkers that are really struggling right now. We can't do that without federal intervention and help, which is why it is so important that many of the great measures that Jerry just talked about were in that third stimulus bill. But one of the scary things here in the city is that this will likely be the largest economic hit that we have ever seen. And the initial projections that we've seen over the last couple of weeks is the current fiscal year we're in right now, not even the new fiscal year, which begins on July 1st, when the city council's negotiating and adopting the budget. We're voting on next year's budget. We are projecting that there's probably a $2 billion revenue loss just in the current fiscal year that we're in right now. And then for the next fiscal year, that number could be $4 billion or more. That's a $6 billion hit in a small amount of time. And I don't have time to go into today what that means for every city agency. I'll just say that my North Star, and I hope the council's North Star, is going to be protecting the most vulnerable, protecting people that were suffering before this and are now suffering with the economic devastation that we've seen, protecting homeless New Yorkers, protecting seniors and children and people that were already in poverty. There's going to be a push, I know, in this fourth stimulus bill. I hope to expand SNAP eligibility for all the folks that are going to need food stamps now in this new reality. We've been focused in the last couple of weeks on food security. 32% of food pantries in New York City have closed in the last 3 weeks, which is alarming. These are frontline centers that help for food in communities. The reason why they've closed is not just because of the wholesale price of food going up, but also because most of these local food pantries are run by volunteers, and most of these volunteers are senior citizens, retired people that do this work who are now at home socially isolating because of the health threat that exists. So we have to be focused on helping eventually all the New Yorkers that are suffering right now. I'm really grateful that the work the congressional delegation has done. But again, I think many New Yorkers would know that $1,200 is not enough for a single person in New York City to get by. And with the significant loss of revenue that we've seen in the last month or so, and the continued loss of revenue on sales tax, on personal income tax, on tolls, on all of these things, it's going to have some dire consequences for the city's budget. So my hope is that in the next stimulus bill, and working with a fearless, amazing advocate like Jerry Nadler and the rest of our delegation, that we can actually get a big infusion of money that supplements the loss of revenue that we've seen in this short amount of time and that we're going to project into the future. And I will end with this. I could talk about homelessness or Rikers Island or all of these other issues that we're working on agency by agency every single day, but I will just end with this. One of the bright spots of my day is actually doing these Zoom conferences, is seeing so many New Yorkers' faces, is seeing smiling faces, is seeing people connect with one another. Even though we are socially distancing, even though we are physically isolating, it is more important than ever that we stay emotionally connected. There is mass trauma that is going on right now. Mass trauma for these frontline essential workers who are in the hospitals, who are seeing people die, who are afraid they're going to get infected and get their families infected. Mass trauma for the people that have lost their income and livelihoods overnight. Mass trauma for people who are separated from their friends and loved ones and who are home alone and trying to get through this. So the best thing we can do is to look out for one another. New York got through the fiscal crisis of the 1970s. New York got through September 11th. New York got through the Great Recession in 2009. New York got through Hurricane Sandy. This crisis is of epic proportions because of shutting down the economy and the physical isolation involved. But we will get through this. We are the greatest city in the world. And we are the greatest city in the world, not because of our geography, but because of the 8.6 million people who live here. We have to be unified. We have to be united. We have to be compassionate and kind to get us through this really painful, difficult moment. I believe in this city. I believe in the Upper West Side. I believe in all of us to bind together to actually get through this difficult time. The city council stands ready, willing, and able every single day to respond to these issues. I didn't get a chance to talk about unemployment or rent or all the other issues. I don't want to keep talking, but I wanted to let you know my heart is open to all of you. I'm sending Comptroller Stringer my deepest condolences for the loss of his mother and the loss we've seen of so many New Yorkers. We've lost so many people. It is incredibly hard, but we will get through this together. Mark, thank you for having me tonight. I apologize for speaking too long, and I'm happy to stay on and take some questions if helpful. Thank you all very, very much. Stay safe and stay emotionally connected. We'll get through this. We're one New York.
Thank you, Speaker. And I'm seeing clapping hands. I don't know if you can see it on your screen. There are, I'm sure, a zillion questions, but we also have a lot of folks lined up to, I know the one question on a lot of people's minds, if you could say a brief word or two about oversight of NYCHA and the concerns there. We've heard reports that the workers there are not being given the appropriate PPE garb that they need, and therefore they are hampered in their efforts. Can you speak a little bit about city's response to NYCHA and the need for oversight there?
Let me just speak generally about PPE for a moment because it plays into the NYCHA question. You know, there has been a total failure from the federal government in not invoking the Defense Production Act sooner and not coordinating the response, where now you have states and municipalities bidding against each other, which is driving up the cost of PPE, and you have countries that are bidding against each other. It's not the best way to do this. We have been prioritizing, the city has been prioritizing PPE for those healthcare workers, but even they are working on CDC emergency guidelines, not using the normal course of PPE changing that you would typically use. And every day it's a race to actually get in touch with these manufacturers in the United States and around the world to get the PPE to New York City. We have seen issues on PPE, not just for NYCHA, but with the Department of Social Services that relates to homelessness, for the MTA as it relates to the subway conductors and the bus drivers and the other workers, for people that are in grocery stores, the people that are working there, for pharmacists. There has been a PPE issue across the board. And I know the city has been trying to parcel out PPE agency by agency, given what we have right now. And this is not an easy decision on how you parcel these things out. I have not been involved in those conversations. If there are specific NYCHA issues, there is so much news every day that I don't catch everything. There's such an inundation of news and what's happening. But send it along to me and my staff, and I'm happy to reach out to the chair at NYCHA, Greg Russ, and see if I can be helpful. Those NYCHA workers need the protection as well, and we need to make sure that NYCHA and the workers there are getting the fair amount of personal protective equipment.
Thank you, because we also need to make sure that our NYCHA neighbors are also well protected. For everybody on the call, my email is markdiller, CB7, MARKDILLER, CB7 @gmail.com. If you would send me your NYCHA questions with NYCHA in the Ray line, I will collect them and send them to the speaker and take you up on your kind offer.
And Mark, I just saw a question in the chat about physical distancing, social distancing, and opening up the streets. 2.5 weeks ago, I called for us to institute a summer streets-like program that would allow us to have more physical separation in parks when we saw them getting overcrowded. Today, the weather was beautiful. Yesterday, the weather was nice. And we see people jammed in to parks, and we see sidewalks crammed. We should open up city streets. We should open up streets to allow exercise and social distancing in a way that works. One of the issues the mayor has flagged, I think there's a better way to do this. I think there have been 6,000 NYPD officers that have been COVID-19 positive, which is terrible for the personnel at the NYPD. And so he wanted there to be a big police presence in all of these streets. We do the summer streets program in a good way. You can use crossing guards who aren't working right now. You can use park employees that are not working right now. You can supplement with the NYPD loss with other folks and do this program. The council's going to keep pushing. The weather's going to get nicer. We need to continue to flatten the curve by having that social distancing in parks and on sidewalks. And the way to do that is identify streets in every neighborhood where you could use for play and exercise to make it safer.
Thank you, Speaker. I'm going to have to leave it there with you, and I have to examine my participants list, so forgive me. I know there may be other elected officials I need to promote or get on the air, but meanwhile, I'm going to call on the West Side Campaign Against Hunger, especially since the speaker just highlighted the controversy and concerns having to do with food insecurity. So if you'd all bear with me, I'm going to unmute Erica Freud from the West Side Campaign Against Hunger. I'm going to share her slides, if I can do it correctly. No, that's not it. I'm sorry. Oh, wait. So Erica, why don't you start and I'll find your slides.
Sure, no problem. Thank you so much for having us be able to present tonight. And I just want to say I really appreciate all of the local elected officials who have highlighted this impact on vulnerable communities. So I'm with West Side Campaign Against Hunger. We're one of the largest emergency food pantries in New York City. We serve about 20,000 families and distribute about 1.6 million pounds of food. But I will tell you, we also are located on West 86th Street between Broadway and West End Ave. So, just like everyone else's life who got flipped upside down 3.5 weeks ago, our entire organization got flipped upside down as well. We are located in the basement of a church. We are also a supermarket style pantry where people come and choose their food. But all of that changed. So what we had to do about 3 weeks ago is adjust our entire operations from a basement location to adhere to all the CDC guidelines so we could have our operations outside. With that, I know someone mentioned volunteer programs. We had a 1,700 person volunteer program that was ultimately suspended, putting extreme stress on our staff in order to still at the same time meet the needs of our community and distribute healthy food. We also had to adjust our entire customer choice supermarket style pantry to increase our purchasing of shelf stable food and hand out prepackaged bags of food, which is really not what we normally do. We also have a very robust social service department that had to go virtual overnight. So many people have been, obviously are unemployed in New York. So we had to quickly adapt so we could make sure we meet all the needs of the vulnerable communities, in New York City. So those are some of the really big things that we've had to do programmatically to be able to continue to meet the needs. Beyond that, we've also been really responding to some acute emergency food needs of COVID-19 patients. We quickly formed a partnership with Bellevue Hospital And in the coming weeks, with some private funding from Bank of America and just our own COVID relief fundraising, we will start to drop off 1,700 bags of food every week for COVID positive patients upon discharge. So they're leaving with a 3-day supply of food. So this is really important, right? Because patients are probably more on the low income side and might have not resources to order food to bring to their homes and things like that. We're also working with Children's Aid in the Bronx. As you know, schools are closed, so many children rely on school lunches. So we are starting an 8-week program also with Children's Aid to drop off about 200 bags of food for families up to a size of 5 family members in the Bronx for the next 8 weeks as well. We're also starting to work with 2 organizations that work with undocumented workers who are obviously very impacted by this. One organization in Washington Heights and one also in the South Bronx. And we'll be starting creating new access points with them over the coming weeks to make sure we can really ensure access to healthy food for vulnerable families. I think the other things I'd just like to kind of touch on is that we really want to thank our Upper West Side community. We've seen an enormous amount of response and support financially, because with all these operational challenges and changes, we've seen unprecedented unbudgeted spending, just needing to buy new equipment that support our overall operational upfields, and just a massive increase of food. So we've seen on average about a $15,000 a week increase in spending over the last 3 weeks, so we could continue to ensure continuity of services. Are you able to get my slides up, or that's okay? It's no big deal if you can't.
They've been up.
Oh, okay. I just can't. Okay. So I think the other thing I would say is, we have real opportunities. If you want to maybe go to the last slide, or the fundraising and communication slide, we have real opportunities for people to get involved with us right now. And I think that together, we're all really shaping these solutions, right? And I think that's what's really amazing about this, that everyone has an opportunity to help us make sure people have access to healthy food. So, a couple things. We have a huge call to action out. You can obviously, donate money directly to West Side Campaign Against Hunger. You can also maybe introduce us to people who you think could be real champions for us, such as people who might want to make relief gifts to really support the work that I was just talking about. We also would really appreciate people amplifying our message, and getting the word out about us as well, because we've been at 268 West 86th Street for 40 years. We've been serving, New Yorkers and creating access to healthy food. So really being able to amplify our message would be very helpful for us. And also, I have to say, we've been able to successfully reopen our volunteer program with new protocols and making sure we're keeping everyone safe. So we're going to need more help in the coming weeks and months with our programs. So we would love for more people in the Upper West Side community to become involved. And I'm happy to share my email address with the community board and send out an email to everyone, and they can contact me with any questions.
Thank you so much.
Thank you.
All right, I'm going to stop sharing. I seem to have an echo there, so I'm trying to solve that. Thank you so much, Erica Freud, for West Side Campaign Against Hunger. We will post your slides on our website somehow tomorrow. We'll figure that out, but we have them now. Where's this? Okay. Okay, so the Q&A doesn't apply to West Side Campaign Against Hunger. Their website, Erica, are you still with us? Your website is WISCA at, what is it? I'm sorry. Hang on. It doesn't let me unmute you. Why is that?
She might have muted herself, but we
Eric,
have
if you
a
muted
question.
yourself, unmute yourself.
It's not letting me.
There you
There
go.
we
There you
go.
are.
Sorry, it wasn't letting me. It's www.wscah.org.
Thank you.
There's also a question.
Rich, go ahead.
There's a question in Q&A that I don't know if it's addressed to you, but it might as well be, which is, do you currently have social media presence?
Yes, it's all at WSCAH.
Thank you so much. I'm not allowed to shill for anybody as the community board chair, so I will just direct people to the website. And if there happens to be a donate button on there, that's for you to decide. Thank you so much. I think I saw Gail Brewer in my list here. We're there. Nope, that's not it. There's Gail Brewer. Gail, are you with us?
I am, thank you.
Thank you. Welcome to Community Board 7. Thank you for waiting.
No, it's fine. And also congratulations, because you were the first board to be virtual and you are still at it. Thank you, Rich. Thank you, Mark Diller.
It's a bigger team than that to thank, but thank you.
I know, but you're the face of it at the moment, but congratulations. So just, I wish I don't know, I don't get as, it's just so much, it's hard. Right now, today, we've had 72,867 active cases in New York City, and 4,009 people have died. My friend in Staten Island today, Debbie Rose, was stating that it's a problem here too, that the morgues can't take any more bodies, and you can't rent another truck. There are none left to rent for bodies in the United States. This is really hard times. I do want to say, we, just like everybody else, we have a newsletter, manhattanbp.nyc.gov. We'll put it on the chat box so you know what it is. So I think there are about 5 different things that we're working on. Lots of good news. I do want to thank the Economic Development Corporation, because they have really vetted and tried to have New York City firms build the face shields, sew the surgical, and to try to figure out how to do the masks. There's a lot of, I know Roosevelt Island Tech with the Cornell Tech is working on it. There's a group Midtown called Adafruit, which is the only manufacturer left in Manhattan, and they are building 2,000 face shields, and I think they've actually delivered them all. So, and the Garment Center is sewing. So there's a lot of good in terms of that, which is not on the face of the news. I will also say health and hospitals has been phenomenal. So we have been working, obviously on the West Side, we have the wonderful work that Mount Sinai does, and they too have been terrific. But we've been working a lot with Metropolitan Hospital, getting money from the developers actually to pay the restaurants to support the workers at Metropolitan Hospital. That is their #1 after PPE request, because there is no place to eat and you're there constantly. Same thing with Harlem Hospital, and we've all been helping them to get PPE donations and made sure that they get them and that they are going to the right places. But this PPE issue is now not new, but the nursing homes, Jewish home was just about out. And the home health care worker, I got several calls from West Side nonprofits that send to their credit to the 95-year-old or the 88-year-old who's home. They're not going to go unless they have good PPE. So we do need to think of that. And if people leave the hospital, and thank God they are, they're going to need home health aides. And those home health individuals have got to have the right PPE. So it's something that we need to perhaps do some surveys of on the West Side to see what the status is, because it is not great. I just want to talk about food, because we have the issue of economic development, health care, and food. So I think you know that Fresh Direct, to their credit, they haven't been doing, I admit, some of the nitrates on the Upper West Side, but they've been doing them from all the way at the bottom to all the way to the top of different nitrate complexes. And they've been doing it for 3 weeks, and they've been doing it every day. And I thank them. But the issue of food is much more challenging, because the Department for the Aging doesn't have or hasn't given to the senior centers on the Upper West Side or anywhere else the list of the seniors for that center who was supposed to get food. And so they're kind of flying without information, because you can imagine there are seniors who are on the list. There are seniors who have to be added to the list. And I just want to say that has to be corrected. So in our newsletter today, we're making a big fuss about it because we've been very nice for a couple of weeks and no more. We also want to thank Center 76, which is part of JASA. I hope they get kosher food. They haven't yet. And we've been advocating with their amazing executive director, Phyllis Roth. But I just want to say, again, the city has to fix these things. They have to be fixed. I want to talk about the great work that obviously all of the senator from the great state of New York, the two of them, and obviously Congressman Nadler, because that Recovery/Care Act will help a lot. But it's complicated. And I assume that there will be calls to individual board members. I've certainly gotten them to help with filling out the forms. The city, as you know, is translating some, transferring others over to the feds. They still have some allocations that they are making. The feds have $350 billion. It sounds like a lot in one of their applications to be sent out. However, it went live, one of them last Friday, and out of the 350, 4.8 billion was spent in one day. So you know that money's not going to last. There will be a fourth stimulus. But if people are interested in getting that money, they need to apply now. There's some feeling that it might be gone by the end of the week because it's a national number. I want to thank Tim Wu, who is a professor at Columbia Law School. If you want to let us know, because I don't want him to get swamped, he's working with smaller businesses and nonprofits with his amazing law students to try to help figure out how to apply. And that's a big, very kind offer. I want to say also that there's a lot of good obviously going on the west side. One of them is that the construction stopped. And I want to thank the governor and the mayor. Sorry. 200 Amsterdam went way over where they were supposed to, no surprise, but they did finally stop. And there were others, I think on 93rd Street and 96th Street. We've had complaints, but not from West Side Construction. I will say that there's a tracker to the credit of the Department of Buildings, and you can find out about that from their website or from our newsletter. You can find out what's legal and what's not. Legal to be building is those that are affordable. So 108th Street, which is the West Side Federation for Senior and Supportive Housing, as Shelley Fine knows, does continue because it is an essential construction site. So it's only if it's affordable housing. I just also want to thank Wishfish very quietly, without a lot of accolades to their credit. They took care of by moving some of their very vulnerable population who were in basically a single room occupancy and were not able to distance themselves from each other. And also want to thank the city because these individuals will live because of the great work of Wishfish and the city of New York, without getting into all the specifics. I finally also just want to say this issue of the future. So I spent quite a bit of time with NYC and Company because I'm on their board, and also with the business improvement districts, the amazing ones on the Upper West Side and all through Manhattan. And I think it would be great for the community board to think something that's very hard to think about, but what's on the other end of this horrific coronavirus? Is it open streets? Is it more open space? Is it relaxing some of the challenges that small businesses face so that they can get back on their feet? There are a million different questions, all controversial. Maybe some things that get relaxed could have a sunset. But I think it would be great for the community boards of Manhattan to think about what they would like to see. Obviously, the great work that Andrew Reggie has done in his professional stance, and the many suggestions that he made as part of how to help business and hospitality alliances, good report could be part of a recovery. NYC and Company is focused on tourism. Tourism is like our manufacturing used to be. They are the bedrock often. So what does tourism look like on the Upper West Side? How do we help all the theaters? How do we help the museums? How do we help everything that brings people to our community and to our city? Those are, I must admit, it's not something that I put number one because I'm trying to get food and get people PPE, et cetera. But it's a really good thing for us to think about, because if we don't, I'm afraid that some of our businesses and culturals and so on are not going to survive. You know to fill out the census. I don't need to say that anymore. One thing that I'd love to see the community board support, if I make any sense at all, is a ticker tape parade. It's going to cost money. I understand, for the amazing health workers, grocery workers, MTA workers, all the people whom you know, postal workers, UPS, who've made this, just sacrifice so much. Thank you very much. And
Thank you.
happy holidays. Happy holidays.
Thank you. I'm seeing a lot of clapping hands and nodding faces. So thank you very much, Borough President Gail Brewer. We actually have not one, but two presentations on the census to make sure that we reinforce that message coming up later. I'm going to try to keep this moving along. I have Linda Rosenthal, who is now, I've now found. So I'm going to unmute Linda and invite her to speak. And then following that, we'll hear from the New York City Office of Emergency Management. So Linda, go ahead.
Hi, Mark. Good to see you and good to see everybody virtually. And thank you for continuing to do your job as community members and as community board members. I think, so many people in the public don't know who to turn to, and I know they are looking toward their electeds and their community boards for guidance and for help and for assistance and for keeping the neighborhood going. So I thank you for that. Last week we were in Albany. We voted on the budget, pretty austere budget, and I won't go into all the particulars here, but there were a lot of cuts to healthcare, ironically, during this pandemic, which I voted against. I thought it was a terrible move to cut Medicaid and cut aid to healthcare clinics and hospitals during this time. One of the solutions that was floated was taxing billionaires. There are 112 of them in this state, and they won't mind if you tax them a little more because they won't even know. One thing that we did not tackle was rent. A lot of people, even though the governor said a 3-month moratorium on evictions, what happens in 3 months? The people who can't pay rent, for example, I can pay rent, so I am paying rent, but for those who depend on jobs that no longer exist, and for small landlords who depend on the rent in order to make their payments to the city for taxes and water, etc., it's a cycle. Everyone's in trouble. And this is where we need the government to step in and implement some programming, some relief. That's what government is there for. So I'm pushing for that. It's great to hear everybody at 7 p.m. applaud the healthcare workers and others who truly are the angels. Everyone else is as well, but the healthcare workers are putting themselves in danger. It's really, really a horrific thing, but they are doing what they were called to do, and they are working hard for them. So in terms of rent, people who have rent regulated units have to live in their apartments for half a year plus a day. And we've gotten complaints and concerns from constituents who say that they are out of their apartments either because they were gone and expected to return, or because of their health or caring for loved ones, they will be out. There's a possibility that they won't be back in time to meet that half a year plus a day. So I've written to the governor asking him to issue guidance through Housing and Community Renewal that there will be a stay on evictions based on, residents for that time period. Unemployment, I don't know if anyone's discussed it, but we're on a call. The electeds are on a call with the governor's office every day. One of the most oft-heard complaint is unemployment, and I'm getting so many in my office. We're not there, but we're on the phones all day and into the evening, so you can just call the regular number. The state is now partnering with Google to set up a much different, less antiquated system of picking up calls and ensuring that people get to register for unemployment. They will get their checks dating back to the first date of unemployment, but I understand it's scary and frustrating if you're calling and spending 10 hours on hold. So that will hopefully soon be rectified. One group of people that is totally left out of this rescue are gig workers, independent contractors, and others. There is no program for them right now, and it's something I've been working with the freelancers union and others to try to come up with and push for some kind of program for them, because people are just, there are no jobs for them for who knows how long, and they deserve to be included in the recovery. I went for a walk earlier and I was astonished, but maybe I shouldn't have been, that there were so many people out not observing the 6 feet distance, not wearing masks, going into food establishments, not wearing masks. I know it's not yet a totalitarian state and we demand that everyone do that, but I just don't understand. And I've taken to talking to strangers under the cover of my mask, telling them that they have to regard other people's health. That's a very important thing, and everyone should mind their neighbor and tell them you need to wear the mask. Nobody, it's transmissible. You might have had it, not know it, or maybe you have it right now and you're sputtering next to your person standing online. So I live on 92nd Street. I have been ear witness to all the clanging and banging at 212 West 93rd Street. And so, it's we're very quick to call the developer and his lobbyist and say, why are you still banging when the order was to shut it down? The same thing at 200 Amsterdam, which was working today. So we sent the Department of Buildings and they sent an inspector. Everyone was supposed to be wrapped up by Friday, at maximum day, Friday. And 200 said they were not, so they got an emergency extension to work on Monday. They were still doing some stuff on Tuesday. Perhaps they needed to, but I have no tolerance, and I know the rest of you don't either, for developers, contractors trying to get around the law. It's with all the anxiety and travails of being stuck at home, worrying about loved ones, etc. You don't need to hear the banging, and hopefully they'll all listen after they get a ticket. Maybe that's what needs to happen. Today, Brad Hoylman and I had a virtual press conference about the Child Victims Act. I know that's something I know that people on CB7 care about, and we're calling for our bill, which extends the look-back window another year to be implemented. Now, we're done in Albany for the budget, and also we have a 2-week break for the holidays. But we can come back through remote voting and implement that and many other bills that were introduced as a way to address some of the problems that have arisen because of COVID-19. So we're calling vociferously to go back to work. We don't have to physically be there to do all of the things we need to in Albany, and I hope that happens.
Linda, I think that the first item on our agenda tonight is support for the extension of the statute of limitations on the because of the COVID
yes.
issue.
Thank you so much. I know you were working on that. I appreciate it very much. And
that's Catherine DeLazaro and Shelley Fine, not me, but go ahead.
It's good. You're the chair. You can take credit as well. But all of you, thank you so much, because people who need to file now, there are no filings in the courts right now. But even so, a year was not enough of a look back window, because some people are just exploring what happened to them. And I've talked about this many times, but it's essential that we extend the look back window. With the Riverside Nursing Home, we've gotten many reports that they're very short staffed. They're supposed to have at least 8 social workers. They only had 3. So we're working with the State Department of Health to make sure that they have adequate staffing. I understand people call in sick because they are sick, but there's a need to make sure the people who live there get their services and are looked after, because they can't do it by themselves when they're in the Riverside nursing home. The same with schools, IEPs. We're trying to help make sure that that children who need IEPs are getting their reports, and we're working with parents. I know middle school admissions were just released, so if anyone has any needs around that, or around anything else. We're sitting at home, but we're spiritually together with all of you in this neighborhood, keeping the West Side great and helping our neighbors. So thanks for listening. Call my office, email me if you need anything. And I look forward to seeing all of you in person soon. Happy holidays to all of you.
Thank you so much, Assemblymember Linda Rosenthal. I see more clapping hands. We're going to go immediately to Anna Schatz. I'm hoping that you're now unmuted. Ms. Schatz is with the New York City Emergency Management folks. If ever there was a time we needed emergency management, I'm guessing now is it. So please take it away. Tell us what you think we ought to know about the current situation and your work.
Yeah, so I just wanted to correct, I am with the City Department of Health and Mental Hygiene.
Oh, not that that's irrelevant. I'm sorry. I was given bad information, but an equally welcome bit of expertise. So thank you for joining us, and share as you will.
Thank you so much. Right. So again, my name is Anna Schatz. I'm with the New York City Department of Health and Mental Hygiene. I'm on the community affairs team and working on the COVID-19 emergency response. So I just wanted to share some information and start with a disclaimer that the situation is rapidly changing, as is our understanding of COVID-19. So I'm going to share information that is relevant as of now, but there's always updates that we're posting daily and updating our website every day on nyc.gov/health/coronavirus. So just to, speak, there's widespread community transmission of COVID-19 happening in New York City. So this means that the virus is spreading between people with low link to travel or a known case. So it's happening everywhere. So the safest thing for all New Yorkers to do is to stay home. And I'm going to repeat this several times, but by staying home, you help protect yourself, you help stop the spread, and save medical care for those who really need it, right? And those who are very sick should definitely seek medical care by calling your healthcare provider, using telemedicine or medical portal, but just stay home as much as you can to help protect our community and help us flatten the curve. So I'm pretty sure everyone knows what coronavirus is. It's a large family of viruses that cause illnesses ranging from the common cold to the more severe illnesses. And the novel coronavirus is a type that was not previously found in humans. And we're currently, in the pandemic. So the symptoms for COVID-19 range from asymptomatic to mild to severely ill. And these can include fever, cough, shortness of breath, and sore throat. The incubation period, which is, between exposure to infection and appearance of the first symptoms, estimates to be anywhere between 2 to 14 days after exposure. So people who are at most risk are those who are 50 years of age and older, those who have other health conditions, including chronic lung disease, heart disease, diabetes, cancer, or weakened immune system. So again, with community transmission, all New Yorkers are at risk, right? But these are the group of people that are at a higher risk than the rest of us. So we don't have a full understanding of how COVID-19 spreads, right? So the spread to people who are in close contact happens with someone that has COVID-19 when a person coughs or sneezes, right? And then people who have symptoms are more likely to transmit the virus to others, right? With that, we are implementing a new guidelines for face coverings, right? So people who do not show symptoms may still be able to spread COVID-19. So face covering can help prevent you from spreading it to other people, right? So you should wear one whenever you leave the home, and this can be anything that covers your nose and mouth. It can be a dust mask, a scarf, a bandana, like literally anything at home that does not include surgical masks and PPEs. We please ask that you save those for our healthcare workers, because as we heard today in this meeting repeated several times, that we are low on PPE for our frontline workers, for our nursing homes and emergency response teams. So as much as you can, please just use anything that you find at home, like a scarf, a bandana, or handkerchief that you're able to maneuver into a face mask, face covering rather. We want to recommend and emphasize good social distancing, good hand hygiene, washing your hands for 20 seconds with soap and water, using hand sanitizer if you don't have access to that. Use precautions of just, staying home and being vigilant about and mindful about how it is that you move around your home and about your community. We want to make sure people don't shake hands, they don't gather in for any reason other than needing to help out someone in your home and dropping off materials. If you're an essential worker, thank you so much for the work that you do, and be mindful as well for your own health and the health of those people that you're helping out. But just covering your coughs and sneezes and monitoring your health more closely than usual for cold and flu symptoms. But other than that, unless you're going outside for like a solitary walk or to need to go get groceries and medicine, please try to stay home as much as possible. That's the only way we're able to fight this, right? So most people do not need to seek medical care, right? If you have mild to moderate cold or flu symptoms, you should stay home. You should not seek medical care or try to get tested if you have mild or moderate symptoms. Again, by staying home, you reduce the possibility of transmission to others, including healthcare workers who are needed to care for our seriously ill. So again, if you're over 50 years old or have chronic medical conditions, you should consult your doctor if you start exhibiting symptoms. And if your symptoms do not go away or get worse after 3 to 4 days, you should also contact your doctor. Just want to add a few more notes. Like if you are sick, you should stay home until all of the following are true: that it has been 7 days after your symptoms started, that you have not had a fever for 3 days without the use of fever reducing drugs, and your cough or sore throat symptoms have improved. All right. And other than that, I just want to say that there's a lot of information that is floating around. And I just want to make sure that I share a few resources and emphasize to please check our Department of Health website. Daily, we are adding more and more guidelines and more information, more data to our website. So it's nyc.gov.
Yeah, I never heard of this. I never heard of any of this before.
So it's nyc.gov/health/coronavirus. Also, you can check the CDC website, that cdc.gov/coronavirus. And if you're feeling anxious and stressed during this really hard time, there is always NYC Well. You can connect with someone that's a trained counselor by calling 888 NYC Well or texting the word WELL, WELL, to the number 65173. And also you can text the word COVID, COVID, to the number 692-692, and you can get daily text messages with updates as well. So thank you so much for this opportunity to speak today and share information.
Thank you so much for joining us. That's very useful and helpful, and we appreciate your making the time, especially since this meeting is running long. I think there may be one or two other additional elected officials that have joined us. I'm going to search for them right now, but meanwhile, I'm going to look for Kim Watkins from the Community Education Council, and I believe, so Kim is unmuted, and I think the superintendent for District 3, there she is also here. So those two are unmuted, and if you would tell us a bit about remote learning and that while I look for the next elected official. We're going to bounce back and forth. Thank you so much.
Christine, do you want to start?
Sure. Hold on one second. I'm sorry. Or Kim, do
Welcome
you
to
want?
Community Board 7. Thank you for being with us.
Thank you, Mark. Thank you. Go ahead, Christine, or do you want me to begin?
It'd be great if you would begin. I'm having some technical issues.
No problem. No problem. Hello, everyone. I'm Kim Watkins. I'm president of CEC3. It's so great to see you. And I've been going back and forth. I apologize. I've been half paying attention, and I'm also on a second Zoom tonight with a parent advocacy group out of Harlem where I live. So I've been sort of going back and forth tonight. So I apologize. Christine and I want to give you an update on, I know a lot of things from the school side and some things that are going on in terms of the district. But before I turn it over to her, I really want to give her and the District 3 team a big shout out. You know, I know I passed along to Mark, and many of you have probably already read that the CEC wrote a letter expressing some frustrations that we have with the sort of parent and home sort of portions of the remote learning policy change that took place over the last couple of days. But we started the letter out, and I just want to reemphasize that Christine, the District 3 team, the principals of District 3, and the staff members have done just such a remarkable job bringing the school system back to life in such quick, with such quick effect. So it has been a challenge, and it has been a bit of a roller coaster ride, as I'm sure she'll express as well. But parents, you know, are doing our best, as we all are, through this incredibly unprecedented period of time for us personally, for our health, and for the way that we interact with each other as New Yorkers, as Manhattanites, as Upper West Siders and Harlemites. We're struggling as parents to get through every single day, whether you are a first responder and you know, trying to manage the concept of going into work and dealing with maintaining a family environment for your kids and continuing learning through the remote systems that we've got set up, or you're at home. I'm lucky to be able to do some work from home, and this is my husband. So, you know, remote learning from home is a struggle on a day-to-day basis. So what we are working on at the CEC in terms of advocating for remote learning is flexibility and stability in terms of the way that we proceed through these next weeks and or months. That is, it has been, you know, the policy has been expressed by the DOE in terms of privacy. Some other elected officials have also been calling for us to at least see if Zoom can correct the questions, the concerns that have been expressed in terms of privacy and how we can utilize and adapt really to the different frameworks that people have already started using and gotten comfortable with. Because the thing that's troubling is whether we're able to adapt to something new, especially now that so many of our kids and teachers have gotten used to using the platforms that we've been using so far. So that from a parent piece is where we are with the remote learning component. Christine, do you want to add anything else in terms of where we are with remote learning on the school side?
Sure. So I just wanted to say thank you to Kim and to Mark for inviting me to CB7. I just want to begin by thanking everyone. And especially I want us to have a big shout out to our students and our parents. And it's pretty remarkable how in such a short amount of time, we have pretty much transformed our school system into remote learning. And there are so many champions that are working day and night to make sure that there is instruction for all children across New York City and especially across District 3. So I just want to say that I'm extremely proud of our D3 teachers, staff, and principals for their work and their leadership and their thoughtfulness and resourcefulness during this. I also want to talk a little bit about the regional enrichment centers. We have 3 in District 3, PS 180 on the west side of 120th Street, 93rd Street, which is the JOA campus, and Riverside School for Makers and Artists on 61st Street. I also want to acknowledge the DOE volunteers, because we have volunteers that are working. We have 2 principals, Charles DeBerry and Stephen Hernan, who are supervising those sites. And we also have essential workers, school safety agents, as well as school food that are also there every single day delivering recreational, robust programs for our essential workers' children. So that's something that we're really proud of as a department as well, that we are doing that work in the Department of Education. I also want to talk a bit about just the conditions and the work of teachers. As you know, spring break has been canceled. That was an executive order from Governor Cuomo. We are, as a department, doing our part, because it was said earlier on the call that the apex is hopefully it's here, but in the next couple of weeks, it is so important that we have recreational activities for our children to do, but not necessarily outside, inside. So we have partnered with so many recreational facilities that have supported us in creating these virtual trips, virtual themes that we are going to roll out tomorrow to everyone. Teachers are still working, principals are still working, and faculty and staff will still be working, but we also recognize, and we've heard from many parents, and I've gotten many emails that people need a break, and we recognize that. So we are going to have it'll still be school, but it'll be a bit different over the next week and a half, acknowledging the fact that families really need that family time. So that's something that I wanted to say. In terms of Zoom, which was another hit that our teachers took and our families took, we got very used to working off this platform to really interact with students on a daily basis. And there are privacy issues, and that's something that we can't just ignore as a department. So we are working to, on other platforms that are more secure. Over the next week and a half, we are hoping to transition to these more secure platforms for our families and our students. And we do hear that Zoom is working tirelessly to fix the issues. And when they do, we talked to our chancellor today, we can revisit. But right now, it's something that we can't use at this moment. The other thing I just want to say is that we are flying the plane as we're building it, and we are running into, just like in every other city agency across the city and across the state, we are running into communication issues. We're running into just things that are coming up that we haven't expected. We received a waiver from New York State in terms of the 3 to 8 state exams, and as you know, and it was mentioned earlier, that those exams are canceled. Similarly, we just found out yesterday that the Regents is also canceled for this year. The governor said today that there'll be more guidance coming on that from the state ed department, and we're waiting to find out more. And we also learned today that school buildings will remain closed until April 29th. We were on a call today with the chancellor. We don't know if we're going to plan for the end of the year with the hope that it'll be April 29th, but based upon what we're seeing and what we're hearing, from the governor, we are in the apex of the apex, right? So chances are that might not happen. So I just wanted to say also this experience has really created so much connection across our city with our principals and our students and our teachers. And we are really working really hard to work with the Department of Education on amazing resources that have been created because we're going to need supports for our students in terms of social, emotional, and also bereavement supports, because as it was mentioned, the death toll is climbing, and this is affecting real people in our city. So we are working on that. So more to come. And I really appreciate the opportunity to present, and I wish everybody well. And I hope that everybody stays healthy and well. Thank you.
So thank you, President Kim and Superintendent Laughlin. The one thing we want to make sure we mention is the school food program, and that is providing food not just for children, but for adults as well now. That's on the website, correct?
So there are a few of those across District 3 on the west side. We have the 3 regional enrichment centers that I spoke about are for the children of essential workers.
Right, got it.
And they also provide food for the children. But yes, there are a number of grab and go schools that give out breakfast and lunch to people who need them and want them.
Very good, thank you.
Yeah.
Kim, did you have a final thought?
Yeah, well, I was just going to say, I'm looking at the list so that everyone knows where they are. One is the 122 Amsterdam building, the Martin Luther King Jr. building. It's technically the High School for Law, Advocacy, and Community Justice that's hosting the Mill Hub location at that school building. Also Booker T at West 107, which I know is not part of the district, but anyway, MPS 9.
Oh, it is, that's us.
Yeah, oh, Booker T is, okay, so MPS 9 as well. And 163, sorry, MPS 163.
Thank you.
Okay.
Thank you.
So four places,
Yeah,
four places
go
within
ahead.
our district. Thank you.
Right.
Final
right.
thoughts?
Well, and then Mark, I was just, I'm on an iPad, so I'm seeing some questions. I know there was a question that probably Christine should answer regarding the staying in touch with students that were maybe flagged as potentially falling through the cracks. Someone asked a question about that in the chat, and I wasn't sure if there were any other questions because they disappeared and I can't figure out how to see them again.
That's a great question.
Yeah.
What we implemented today was a way in which we can actually take attendance for our students so that we can get a better sense of who is engaged and who's not engaged. As many of you realize, when we had 3 days to kind of gear up for this remote learning, and we really pretty much gave all of our schools gave all of their devices in terms of laptops to children. And then the Department of Education also created a way in which students can apply for a device. So that's something that I'm tracking with principals, and that list is growing because as time goes on, because parents can have a one-to-one device for their child. So in the very beginning, there were many children that were sharing 2 devices from home, but given that this is going to be going on a long time, that list is growing. So we are tracking students through attendance, and it's not period by period attendance, but it is really more of a tracking system for engagement. So that's how we can monitor where students are. And also through ensuring that everybody has access to a device. So those are the 2 priorities that we're really focusing on to make sure that students don't fall through the cracks.
Thank you so much, both of you. This is amazing work in an incredibly difficult setting. I do need to move the meeting along, so I'm going to say thank you for joining. You're welcome anytime. You don't need to be invited, by the way, so come on anytime. Thank you so much, Superintendent Christine Laughlin and CEC President Kim Watkins. Thank you both. I'm going to try to find, what did I just miss? I had Helen Rosenthal. Don't go away. Where are you? Oh, gosh. I used to be better at this. I think unmuting Helen Rosenthal. There she is. Thank you for waiting. Welcome to CB7.
Well, thanks so much for having me. Mark, thanks for doing this, and kudos to the community board for continuing to do all the work that you're doing. Similarly, my office is trying to continue to do all the work that we usually do, but we're doing it online and via email. And folks should go to my website, helenrosenthal.com, where you can get email addresses and phone numbers, where to call in order to get in touch directly with staff. What will happen is you'll leave a message and then staff will call you back. Also, I encourage people to sign up to get my emails. A lot of the information that we reviewed today goes out on in my emails on a regular basis, although you can also just click on the resources page and we list out all of this information and try to keep it up to date as much as possible, with links to the Department of Health, to state unemployment, information about how seniors can get food, etc. So I really urge you to sign up for those. I think the focus of my work in the first few weeks, in addition to setting up an office, but I see my role as connecting our constituent experiences with City Hall so they can do a better job helping our constituents, right? So, you know, I've been helping them with, you know, ideas, making sure links work, and really getting to a good solution for the senior meals program. That's been my biggest concern. I don't think we're there yet, but I do think they're working really hard on figuring out a way to make sure that seniors get food. One thing to a point that I'm seeing, since I'm working with my colleagues citywide, people should have a sense of this. Even our district is so well off, even to the extent of the food that's delivered to our seniors is better quality than the food that's delivered to seniors in the Bronx. And I've alerted City Hall about this, alerted my colleagues about it, but you know, for example, in the meal plans in the Bronx, they're getting cans of food. And I know this sounds silly, but not everyone has a can opener. And there are council members who are making the deliveries themselves because the systems really just aren't up and working. So I always try to remember, we should consider ourselves lucky on the West Side, but still trying very hard to make sure it's working. We sent out a letter recently to small businesses in this area, just letting them know about some of the loan and grant programs that are available. If you know someone, if you know someone who maybe didn't get that letter, who wanted to, if you could just email my office and we'll add them to the list. We've set up 3 volunteer opportunities. One is caring calls, where we've connected volunteers with isolated seniors who just need a call. And we have sort of a vetting program for the volunteers, and then they get set up with a needy senior in the district. We have a building captain program. So if any of you are interested in being a building captain where you're communicating information in your building, we have a very robust program going. Again, you can sign up to do that on my website. And lastly, for people who are really good on their computers and finding stuff, we have a volunteer project where people are doing research on a variety of projects. One issue that was very big at the beginning of the shutdown was non-essential construction work. And we worked very hard along with everyone to get the governor to have a non-essential construction list. That was terrific, and that stopped some construction in our district. Some people may have noticed that today there was construction again at some of the big sites, the one at 200 Amsterdam, of course, and then on Broadway between 93rd and 94th. What we've come to understand is there really was some emergency work that has to get done at those sites. although we have sent out, the Department of Buildings did send out inspectors who are going to fine those construction sites due to the lack of social distancing. But we're trying to get that ended. There was emergency work, but we think that'll be very short-lived. Lastly, as chair of the Committee on Women, I'm really focused on so seniors, nurses, and domestic violence. We all know that, you know, domestic violence is going up in the household. I really hope that our school system is sending messages about, you know, being kind to their people, being very kind to their children and parents during this rough time. I'm not convinced the city's doing as much as it could do. And if you get my emails, you'll see that I'm writing opinion pieces. But I really, more important than that, am doing research on what other cities and countries have done that have been experiencing this before us, and making sure that the city does its part. I could give you a few examples of that if you're interested, but I'm going to just keep moving on. Lastly, just to say that I'm in contact with City Hall and with the Speaker's office every day. I'm bringing to them any types of concerns in the systems, in the logistics that they've set up in order to meet the needs of New Yorkers. If there are things that you recognize, please just email my office, helen@helenrosenthal.com. Happy to work with you to try to sort this out. And I know my Chief of Staff, Marisa Maka, and Mark Diller have been working closely together, and we really appreciate that connection, Mark.
Thank you, Helen. Thank you, Councilmember Rosenthal. Appreciate all of that work. I know this is running longer than we anticipated, but there are a lot of folks who want to address us, so I'm going to make sure that we get to them all. Here's what we're going to do next. We're going to call on Senator Robert Jackson, who I'm going to unmute, and then after him, I'm going to call on the first of our census presenters. That'll be Jolie Golden, and then following that, I believe, if I can find him in the attendees slot, is a representative from the Mayor's Office Community Affairs Unit, Andrew Kunkas. So that's the next up, and thank you. And Senator Jackson, I believe you should be unmuted, so please go ahead.
Well, thank you, Mark, and good evening, everyone. And I'm not going to be that long. Let me just say this, that obviously, you know, we're coming off the state budget, which is not a great thing, considering the fact that we're about $10 billion in the hole and probably go deeper in the hole, and not even talking about New York City. So obviously we have to adjust according to this COVID-19. And so just everyone that's here, over the 102 participants on your conference, they can go to covid19.senatorjackson.com, and there's a whole menu of items that you can look through as far as resources for residents and small businesses. And that's very, very important. My staff has put together a mutual aid network to help people in our community overall. That goes throughout the entire district. And as you know, my district, most southern part is 26th Street and 9th Avenue, goes all the way up 13 miles to Marble Hill. But if you go to covid19.senatorjackson.com, there's a whole menu of everything. But I just wanted to say that obviously in the budget, there was over $1 billion put in there for unemployment. And obviously the governor and all the staff are trying to deal with the over 1 million people that are trying to get online to get unemployment. And most important thing, if it wasn't said already, you keep trying and get in there. And once you're in, the first day that you're unemployed, then your benefits will go from that point forward. So with that, I really wanted to come on, and I can come at a later time, either next month. I wanted to listen to what everyone is saying so that I can listen more so than talk. And I know that my colleague, Linda Rosenthal, was on already. I don't know if anybody else at the state level, but just go to covid19.senatorjackson.com. There's a whole menu of stuff there that people can look at to help.
Thank you, Senator Jackson.
I'll turn it over.
Thank you so much, Senator Jackson. And if your office wants to send something to me as a PDF that we can put on our website, one of your updates or that sort of thing, we'd be delighted to do that as well. We'll figure out how tomorrow, but that's what we're doing. Thanks so much for joining us. I'm going to unmute Jolie Golden, and as I do so, Jolie is with the federal part of the census. We'll also hear from Julie Menon, the city response to the census. And as Gail talked to us, the census always would be important, but it's especially important because this is how we prevent some of the inequities that we're facing right now by preparing for the future. So Jolie, you should be unmuted. Please go ahead.
Mark, can everyone hear me? Can you hear me?
Looks like yes. Looks like yes. Go
Great.
ahead.
Thank you, everyone. So as we all know, the census is important, safe, and easy. I've spoken to you before, and clearly the census, like everything else, is being impacted by the current situation. Mark's going to pull up a few slides. The first one shows a typical piece of mail that everyone's getting. The mail is on schedule. For those of you who wanted to respond by paper, or whose neighbors or whose parents want to respond with our paper questionnaire, that is coming right now, April 8th to 16th. It should be in your mailbox. In terms of how New York City is doing, we could do better. We are obviously trying, we are all impacted, but now is a great time for people to do the census because they are at home. It is easy to go online. We know that some of your, many people in the city may be temporarily relocated. They are still counted at their home address where they live most often. I shared a flyer with Mark that he will send out or post, and that says how you can fill out the census without the census ID that you are sent in the mail. So for those of you who did it online, you probably used a code that came in this letter, in a similar letter. Obviously, this one doesn't have a code. So you don't need the code. You can fill out the census by going to 2020census.gov and hitting respond and filling in your address. So please encourage everyone you know who may not be in your building. My building at 73rd and West End, I know, is half empty. So half of those people are not getting that census mail that they need, or they think they may need, but they don't need it because you can just respond from wherever you are. In terms of how the census is being impacted and scheduling, right now we are still doing our mailings, but the self-response period, when you can respond on your own and when we will be taking in responses, has been extended. So that period will now go to August 14th. In addition, the time period, Mark, don't worry, I'll tell you when to move the slides, although this is exciting. The time period for when we will be going out in the field has been pushed. So we will not be door knocking until May 28th. And that obviously is subject to consideration about how our public health emergency is doing at that point. We're obviously not looking to put anyone in harm's way. The homeless count has been pushed. The current date is May 1st. So there's a memo on operational adjustments to the census, which I'm happy to share, but those are three of the key highlights. One of the things which does not change is the fact that the counts will be due to the public and the president as of December 31st. So we will still have to deduplicate our data, we'll still have to clean up the data, and we'll still have to get it out in the same time period, which makes the self-response right now even more important. The map that you're seeing here, which, in normal circumstances, I would not be sending you screenshots. We'd be live and hopefully somewhere nice like the Rubenstein Atrium, looking at a live map. You can access this map. It gets updated every day after 3 o'clock. The current national response is 45.7%. Look at the states. The ones that are in dark orange are the ones that are lowest in terms of self-response. The ones in light blue are highest. Mark, now we can go to the next slide. Thank you. In terms of New York State's response, the state's overall response is at 40%. versus the nation at 45.7%. Moving to the next slide, and you can see all of this on this actually pretty fun map. Manhattan's response is 37.3%, and New York City's overall response is 35%. Obviously, the more that we can do to encourage our neighbors, our colleagues, our friends, our family to respond, the better. Even gestures like Gail Brewer, who made sure that 100% of her staff participated by completing the questionnaire, is something to be applauded. If everyone can have 4 or 5 people or more complete the census, that will help us to move forward. And in terms of completing the questionnaire, it's important that everyone counts everyone in their household, documented or undocumented. The information is kept safe. Last thing, for those college students, even though they may be living in your living room or your neighbor's living room right now, they are counted where they live most often, which is at college. There is a handy video online which college students can watch, but they should be counted separately where they usually live. I think that's pretty much, I would just encourage everyone to please complete the questionnaire, and to encourage everyone to. We have flyers that we can send out, and we'll be working, we're working with agencies that are responding to try to get those flyers into food deliveries and other places. There are handy online badges that you can post. Anything you want to do in social media, you can create your own PSA. And I'm sure that the New York City Census can tell you many ways that you can volunteer. We will be hiring people. The deployment just may be a little different, and the training may be different. There are only skeletal staffs right now at our area census offices. So if you know people who applied for work and are in the pipeline, they will be contacted. If they've already been contacted, they will be sent for training. But clearly, we are not doing fingerprinting in person right now. That's it for my update. I'm happy to take questions. Very important. I don't want to miss these last things on my screenshots. Mark, go back to the screenshot, please, because that showed the Upper West Side and how the Upper West Side is doing. So you can drill down to the census tract on the map. If you look at the CB7 area, you can see that right now there's interestingly just one tract that's darker brown. The ones that are lighter show a really nice response rate of over 40%. For New York City, that's quite good. If anywhere we can be counted, I think it's the Upper West Side. If you go to the next slide, I did a screenshot. That's the tract itself. You can see, hold on, that it is between 65th and roughly 58th, between West End and the river. So let's go to the next slide, Mark, and we will see, I just did a screenshot of Google Maps so you could see what's there, which is some of those swanky buildings on the, in Riverside South, and some other areas, some schools, but we need to see how we can drill down and make sure that those people who may not be in those residences right now can be completely and accurately counted. So thank you for doing your part, CB7, and for hosting us.
Thank you so much, Jolie, and thank you for your work on this. I've got a lot of folks lined up, so I'm gonna unfortunately not. I think you covered the where remote folks living temporarily are supposed to respond, and that was the one question that I got. So I'm going to move right along to Andrew. And Andrew, I don't know how to pronounce your last name. Whoop! Did I lose you? Andrew Kunkus. All right. I don't see Andrew unless he was promoted. Was he promoted? Here he is. I'm trying to unmute Andrew. It's not working. Andrew, I think you have to unmute yourself too.
There we go. Can you guys hear me now?
There you go. Tell us where you're from, Andrew, and please go ahead. Welcome to CB7.
Hey, thank you so much for having me. My name is Andrew Kunkus. I am the new Manhattan Borough Director in the Mayor's Community Affairs Unit. Before this, I was a community associate at Community Board 8 Manhattan, so on the Upper East Side. And while I was there, I had lots of opportunities to work with Jolie Golden from the census to make sure everybody is counted in just one place. And then before that, I attended Baruch College and got a degree in public affairs, which I think has allowed me to get in a position where I can best serve the community and the city at large. So today I just want to give a brief update on what's going on with the mayor and what's been happening with the city. So earlier today, the mayor announced that the administration projects over 300,000 gowns to be produced by the end of April in factories across the city. Many of these manufacturing companies are based out of the Brooklyn Naval Yard, and it's great to see that the city is pitching in to help get the supplies that they need. New York City Parks is closing down dog runs as part of an ongoing effort to maintain social distancing in public spaces. The city's been monitoring these parks closely and has observed overcrowding at dog runs and received numerous complaints. This week, New York City Parks will also remove any of the remaining basketball rims and tennis nets and lock up all courts with a gate, including handball courts. And on Friday, the city closed all playgrounds. Our parks remain open for people and dogs to enjoy. Earlier today, Mayor de Blasio announced a new program called Fun at Home. It's a free new digital platform to provide safe, fun, and entertaining virtual activities for New York's teens and young adults. It's the first of its kind campaign, and it combines city and community resources to engage teens who are at home during the COVID-19 crisis, and also provides tips to cope with the public and mental health challenges that may arise during this difficult time. You can visit nyc.gov/fun-at-home or text FUN to 97743 to receive the latest updates. And I'll make sure to include that in the chat after I'm done. Also today, the Mayor's Fund to Advocate for New York City announced a partnership with Deborah and Leon Black Family, the Robin Hood Foundation, Aramark, and the American Red Cross to launch New York City Healthcare Heroes, which is a citywide philanthropic program to support the heroic efforts of more than 100,000 New York City healthcare professionals on the front lines combating COVID-19. This program will provide support to at least 300,000 and up to 500,000 packages of food, household cleaning and personal care products, and more to staff at hospitals across the city. And to any medical professional out there, we just want to urge you that if you have the opportunity, please volunteer for one of the 11 acute care hospitals in New York City. We can use every hand we can get. You can do so at covid.nychealthandhospitals.org/volunteer. I'll also include that in the chat. And I just want to thank all of you for the time and effort you give to the community. Without you, we wouldn't be able to make sure these messages are disseminated correctly throughout the community. And lastly, I would like to wish everyone a very well and very happy Easter and Passover. Thank you so much for having me, Community Board 7, and I look forward to meeting you in person in the near future.
Thank you, Andrew. Thanks for being with us. I'm going to keep this rolling along and ask Julie Menon. Are you ready, Julie? I'm unmuting you.
Yes, I am. Can you hear me?
I sure can. Thank you for joining us. Julie Menon is with the city response to the census. So we're going from the mayor's community affairs to the mayor's efforts with respect to the census.
Great, Mark. Thank you so much for having me, and hello everyone at CB7. So I know Jolie talked about the importance of the census, but let me just say, at a time of COVID, when obviously so many things are out of our control, we need to make sure that everyone fills the census out, because it's basically linked to funding for our hospitals, funding for Medicaid, funding for children's health insurance, and obviously funding for public housing, public education, workforce development, so many things that are vital. And so I just want to make sure to give that message across, that at a time where things do seem out of our control, there's actually one thing that we can control, and that's making sure that not only do we fill the census out, but that every person we know who lives in New York City fills the census out. So I'll be very brief. Jolie talked about some of the stats. I do want to highlight a few numbers on the Upper West Side, though. Mark, if you wouldn't mind going forward a couple slides through, that would be extremely helpful. So here, 2010, this is really important to note. So in 2010, New York City had, quite frankly, an abysmal response rate to the census of 61.9% versus the national average of 76%. So we were close to 15 points away from the national average. Now, how are we doing right now? Jolie talked a little bit about this. If we go into the next slide, you can see, and this is, I should add, from yesterday. So the numbers are, New York City is now actually at 35%, but it gives you a sense that we're about 10 points away from the national average, but we are, of course, the epicenter of COVID. So going to the next slide, you can see the Upper West Side on average is at 42%. So faring much better than the citywide average, better than the Manhattan average, but we still have a long, long way to go. And so what I really want to ask everyone at CB7 to do is, if you could commit to calling, reaching out to 10 people you know, and making sure they filled the census out. It couldn't be easier now to fill the census out, because obviously you can do so online by going to my2020census.gov, and it takes 10 minutes to fill out. There's also a toll-free number. So for our friends, our neighbors who do not lack access to broadband, there is a toll-free number. All of this information, if you don't have it, is on our website, which is nyc.gov/census. So I can tell you what our office is doing. We have disseminated over $19 million to 157 community organizations that are trusted voices throughout New York City. So they are working hand in hand with us to make sure that we're reaching particularly hard to count communities. We also have a large field operation. You might have heard about that. We divided the city into 245 neighborhoods, and we created a neighborhood organizing census committee. We have over 6,000 volunteers. We also are doing text-a-thon. So we did a text-a-thon about a week ago where we reached over 1 million New Yorkers by text. This is peer-to-peer texting. If any of you want to join our next text-a-thon, please join us by going to nyc.gov/census, and you can sign up. You literally text, obviously, from your home, and it's a great way to reach friends and neighbors. You can also volunteer to not only do our text-a-thon on the Upper West Side, but if you want to work in a hard-to-count community, another community, we welcome that as well, and we really need that help. And then we have a whole advertising and marketing campaign. In light of COVID, we quickly took our subway ads and our bus ads and converted them to digital and TV. So hopefully you're seeing some of those ads either digitally, whether that be on Facebook, on Twitter, on Instagram, on WhatsApp, or on TV and on radio. And we are advertising in over 20 languages to make sure that we're reaching all New Yorkers. We're also working very closely with the Department of Education. And so making sure that with virtual learning that we're getting messaging out about the census. So there's so many ways that we could really use your help in the coming days and weeks. As Jolie mentioned, the Federal Census Bureau is doing an additional mailing. That's really important. We really need that. But again, we need to reach every single New Yorker. And so taking the time to reach out to your friends and neighbors, to send an email message, to post on your social media. We have, just like the I voted sticker, we have an electronic badge, like a sticker, if you will, that once you fill the census out, you can put it on your Facebook, you can put it on your Twitter. So we encourage you to do that as well. And so in the interest of time, I'll stop there. There's a lot more I can say, but Mark, I don't know if you want me to take any questions, or if not, happy to move forward.
I'm sorry, Julie, we're just running out of time here. So I appreciate your being with us, and thank you for sharing the strategies on how we can help move this along.
Thank you.
Thank you so much. There were two folks. Is Michelle Booker still on the line? I'm trying to find you. Where are you? Maybe you're under attendees. Michelle Berger from Congressman Espaillat's office. Rich, if you can find Michelle. I'm also trying to find Michael Stinson from the Comptroller's office. There's Michael. Here we go. Michael, a quick hello from the Comptroller, and please send our condolences on the loss of his mother to this terrible virus.
Absolutely, and I just wanted to be brief, and I have a couple of reports that I'll send over to you. I won't go over them now, but I just wanted to thank everybody on behalf of the Comptroller for reaching out these past few days. They've been extremely rough for him and his family, but he's in pretty good spirits right now, and he just wanted me to thank you all for reaching out, and again, thank the healthcare workers that were there to be able to assist his mother and many New Yorkers that are impacted by this horrible, horrible virus right now. But again, thank you all, and I can't wait to see you guys in person again, because it's, as many New Yorkers right now, we're getting tired of being stuck inside, and we just want to see each other, and I'm with you guys with that. So can't wait to see you guys soon, and I'll talk to you later.
Thank you, Michael. I still can't find Michelle Booker, but I will keep looking. We have not had a community session and heard from the community. We also need to do some board business before we lose quorum here. With a quick show of hands, if there's anybody that wants to speak in the community session, please put your hand up now. Meanwhile, if Michelle Booker could text me on my phone and tell me where you're at, or if Rich can find her. Okay. I see Shelley. Let me unmute Shelley, who's going to tell us about the Euclid Hall Wishfish matter that I believe Gail started to talk about.
Yes. Most people don't know that for decades, the Westside Federation for Senior and Supportive Housing, of which I'm the president, has provided housing and services on the Upper West Side to 275 seniors that live in the Euclid Hall. The Euclid Hall is between 85th and 86th on the west side of Broadway. At Euclid Hall, the residents have a private room, but they share bathrooms, kitchens, and have communal meals daily. In response to COVID-19, we had healthcare experts and professionals confirm that it would be extremely difficult to isolate cases at Euclid Hall, given the shared living arrangements. Simultaneously, we experienced the first case of COVID-19 at the building. On Friday, March 27th, working with the city, we identified hotels where the residents would have private rooms and bathrooms. We then arranged for 3 meals daily and on-site nurses at the hotels to assist in early diagnosis. Recognizing that the time was of the essence, and over that weekend, we worked tirelessly with our residents to prepare them to move out on Monday. We moved everyone but a small number of residents to hotels where they can have better chances, and thank God no one has had any exposure there. The move was coordinated with the city to make it safe as possible. We want to thank the city because this was a unique effort, the only one of its kind in the city, and for their assistance. Our wonderful Wishfish staff led by Paul Freitag, and in all our buildings, not just the Euclid Hall, and also to the people who supported our social workers who are currently supporting those people at the hotels. We also want to thank, on behalf of Wishfish, all the many members of the Upper West Side community who reached out to support us during this difficult time. Things are going well there. We do not know when they're going to return. We hoped it was 2 weeks, but people are finding they have bigger rooms and they have private baths and 3 meals a day and support. So some of them were initially upset about the move, as anyone would be, but I think some of them are getting to like it, which is a good thing.
Thank you, Shelley. And congratulations to Wishfish on a job well done in a trying and difficult situation. I'm trying to find, oh, here it is. I think I've now found Michelle Booker from Congressman Espaillat's office. Congressman Espaillat, who's been running a call-in every Wednesday night with the hospitals in the area to provide updates, and we're grateful for that update. Ms. Booker will have, we're trying to move the meeting along, but we definitely want to hear from the Congressman and from you.
Sure. Hello. Good evening, everyone. I'm Michelle Booker. I'm the Deputy District Director for Congressman Espaillat. Thank you, Mark, for your patience in trying to find me. I will be short because I can submit information you can put on your website. I would just like to let everyone know that the Congressman has put together a detailed list regarding the Small Business Administration's coronavirus assistance, including all the variety of the Paycheck Protection Program and other programs that are available. The Congressman has also partnered with or collaborated with New York Presbyterian as well as the Hispanic Federation for Uptown. So if someone has a business in the Washington Heights, Hamilton Heights, Inwood, or the Marble Hill area, there is $10 million available and an application for that as well. So, and the Congressman has really been pushing to make sure that hospital staff and first responders, as well as the nursing homes, are having their supplies. He's making a call out to that. He is aware of food insecurity in the district and trying to make sure, especially that the seniors are receiving their meals. Many of them, have mobility issues, can't go out, and they're not able to go to their senior centers. If there are any further questions, I will provide my information, and you're welcome to follow up with me. Thank you for your time.
Thank you so much. And if you want to send along the Congressman's latest update or your contact information so we can post it on our website, I would be grateful to receive that. I have 3 community.
I'll send it to your email. Is that okay?
That's perfect. Thank you so much. I'm going to call
You're
on
welcome.
Zachary.
Thank you.
I have 3 community participants with hands up, and I'm going to limit it to those 3 because we do need to do some board business tonight. I know this is running longer than we anticipated, but we were hearing good things, and we're grateful for that too. Let me see, Liam, where was Zachary? I thought I had Zachary Campbell.
I just promoted him to a panelist, so he
please
can
call on
video.
him, and then after him, we'll hear from Constance Clark and then Liam Galligan, okay?
Okay, I unmuted Zachary Campbell.
Thank you. Zach, are you with us? Do I have to do anything to get Zach?
Apologies there. Wouldn't let me
There you go.
for a second. So I'll be very, very brief. First off, for those who don't know me, my name's Zach Campbell. I'm the community liaison for the American Museum of Natural History. First and foremost, we just hope everyone is healthy and well, and best wishes to all family and friends here as COVID-19 continues to impact the city. As many of you know already, that following the governor's executive order, which declared that all non-essential construction should halt, and with additional guidance from ESDC and from New York City Department of Buildings, the Gilder Center construction paused as of the close of business last Friday. And that's until further notice. Crews had been working to secure the site and make sure that it was safe in accordance with DOB's guidelines. Staff will continue to monitor and secure the work site. So you may see folks going in and out. There's still security and monitoring and engineering that's going on there that's essential. And we'll continue to provide updates as that situation changes. Additionally, the museum continues to be temporarily closed to the public. That's been the case since, I believe, March 13th. Status updates and online resources, I'll post this in the Q&A section, can be found at amnh.org/health-safety. That also has a variety of resources for online sessions, if you are interested in any of the museum's educational opportunities, and it also has resources for teachers. So thank you very much and best wishes to everybody.
Thank you, Zach. I'm going to call on, as I said, Constance Clark to be followed by Liam Galligan, and then we're going to go to the business session. Thank you. Constance, you should be unmuted.
This is Constance Clark. Can you hear me?
Yes, I can. Please go ahead.
Okay, I'm going to bring up something that's more business as usual for the community board, but maybe in the midst of this unprecedented situation we're in, maybe it's good to try to do some business as usual. Also, some of us are looking forward to the days when this ends. At any rate, I represent the Cantilever Opposition Group. It's a group of Upper West Side residents that are opposed to the cantilevered building being constructed at 91st and Broadway. We believe that starting a precedent of cantilevered buildings on the Upper West Side, which is largely landmarked, is simply not in keeping with our distinctive historic neighborhood. As most of you are aware, the building at 91st Street is being financed by entities related to Michael Dell of Dell Computers. Our organization will be making an appeal to Mr. Dell to halt construction of the cantilever, which we believe will be an incredible blight on our neighborhood. We have no issue with the originally filed plans for a straight up building. Despite the difficulty of soliciting signatures in the current environment, over 350 residents have signed a petition supporting our efforts. We are asking the community board to support our efforts by co-signing our letter to Mr. Dell. And apparently someone has expressed the opinion that without a zoning violation, the board can't take action. We don't agree. The community board is largely an advisory body. There could be nothing more appropriate than for the board to advise Mr. Dell that a cantilevered building is not in the best interest of our community. Thank you very much.
Thank you so much for joining us. And then was there one more? It was Liam Galligan. Isn't that right, Rich? Is Liam Galligan?
And let me.
Can you unmute him?
Done.
Right. Hello.
Okay, Liam, go ahead.
Yeah, so my name is Liam. I work for Assemblyman Danny O'Donnell. Trying to make this as quick as possible, especially because I am quarantined with my family and we have goats upstate and I have to go feed them. So make this as quick as possible. First thing, the budget. There are 9 bills in the budget. Danny voted for 8 of them. The 9th bill, the controversial 9th bill that has Medicaid cuts, no increase in CUNY funding, and a rollback of the historic bail reforms we did last year. He voted no. So just wanted to make sure that got out there. And the second thing, the major issue we are dealing with is unemployment insurance. There's a huge bottleneck in the phone lines. It's been a major issue, kind of a nightmare for so many people. So if anyone has any issues with that who are listening to this, we are trying to ferry as many people across that river as possible. If they have any pressing deadlines, any pressing needs, we're trying to get as many people until our contacts at Department of Labor get sick of us and cut us off. So our office number is 212-866-3970. Again, if you're having any issues with unemployment insurance, specifically getting through to them on the phone, our number is 212-866-3970. And that is it. And hope everyone is staying well.
All right. Well, thank you so much, and Liam, and for that report. I'm now going to declare the public session closed. I thank you for that. We're going to go to our business session. We were asked to streamline the business session as much as possible. And so we're going to do that. And the way we're going to do that is take one vote at the end. You can still vote yes on one resolution and no on another, but we have to do it by roll call, and taking 14 roll calls would just take too long. So I'm going to call on the committees to present their resolutions in their order. I'm going to implore them to be brief. I'm going to assume that all of our colleagues have read ahead and understand what is being voted on. And so the first one is going to be Health and Human Services, having to do with the extension of the statute of limitations to aid those who cannot functionally file their claims under the Child Victims Act. And that is Shelley and Catherine. So Rich, can you help me by unmuting them and taking this away? or maybe I need to do it. Catherine, you're unmuted.
Mark, can you also share the screen, pull up the resolution?
I sure will. Let me unmute Shelley first. I lost Shelley. If he's here, then
I'll look for him. Yeah, I don't see Shelley either.
Okay.
Wonder if we lost him. You're up, Catherine.
Okay, just waiting for Mark to pull up the resolution.
It's there. Do you see it?
Yes. Okay, so this is regarding the extension of the revival or the look back window under the Child Victims Act. So this was signed, the Child Victims Act was signed into law in 2019, and it extended the statute of limitations for victims of child sexual abuse to file claims against their abuser and or the institution where abuse occurred. There was the Child Victims Act created a one-year revival or look back window for victims to file claims if the statute of limitations had expired for them. So that started last August and concludes this August. To protect the health of those working in the system, the Office of Court Administration recently announced an indefinite pause of non-essential court filings. It's not yet clear what impact the current pause will have on the 12-month window, but in the meantime, it's very difficult, if not impossible, for people to meet with lawyers and to file. At the same time, Senator Hoylman and Assemblymember Rosenthal, who co-sponsored the Child Victims Act and also co-sponsor the current bill, which would extend the revival window for an additional year, or they're co-sponsoring a bill which would extend the revival window. This was not extended as part of the recently passed state budget, but could be extended through legislation. The legislature is currently on break and may reconvene the week of April 20th, at which point a vote to pass the bill may occur. And I just want to say that I agree with what Assemblymember Rosenthal said when she said that it's very difficult for people to make the decision to come forward and file a claim, so they need more time. So to conclude, the Child Victims Act reflects the unique character and severe consequences of sexual crimes against children. It allows more victims the opportunity to seek justice, and as a result, takes a positive step towards protecting children from sexual abuse. Though the passage of the Child Victims Act in the initial one-year window is a great first step, victims of child sexual abuse need more time to have the opportunity to access justice. So now, therefore, Community Board 7 calls on the New York State Assembly and Senate to pass the bill to extend the revival window this session and for Governor Cuomo to sign it into law. Community Board 7 Manhattan further calls on our elected officials at every level of government to continue to provide the funding and attention necessary to educate New Yorkers about their rights. So that's our resolution. I also just want to add a comment to do with resources that are available for people that are currently experiencing domestic violence or gender-based violence. So Mark, can you pull up the page with the number on the website?
Give me 1 second. Okay. Is that it?
Yes, so to find services for domestic and gender-based violence, people can go to this website here or call this 24-hour hotline. So, and we can share this with others. New York, the city, through the text messaging system, sent this out. We thought that would be helpful to project as well. So does anybody have questions or comments related to the resolution?
Okay, so if my board colleagues would make a note on their list of resolutions or make a number, this is number 1, as to how they intend to vote. I thank the Health and Human Services Committee for great work, especially stopping on a dime since this only came up over the weekend because of the governor's remarks. And this is their, I believe, I'll share my view that this is an appropriate response. And so I thank you for that, and I'm going to keep moving our agenda. The next item is the transportation resolution, which is also a response to the COVID-19 crisis. I'm going to look for Howard and for Meg. And why can't, oh boy. Somebody someday will explain to me how this is organized. It's not organized alphabetically. So I'm having trouble.
Hi there. Hi there.
Hey, Howard's on. All right. Take it away,
Great.
Howard.
We have mercifully only one resolution. I just wanted, on behalf of the committee and Meg, my co-chair, to thank the people who are really being heroes in this environment. And we have a resolution which is designed to help them out, give them an alternative way to get to work. It's a resolution calling for a temporary interim network of bike lanes so that people can get to work, essential workers can get to work without using the subway, and get to work in a way that's safe and enables them to social distance.
If I may add, the resolution also calls for enforcement of all street users to maintain that safety and for rebalancing of the city bike stock, so that if an essential worker needs to get to work, there's something for them to ride. Questions on that? I'm clicking on panelists first. Anybody raising hands? I don't see any hands raised. Going to attendees. Okay.
Jay Adolph and Ken Coughlin have their hands up.
Oh, they have their actual hands up. I'm calling on Ken because I see you first. And I think Madge did too. Ken, go ahead.
Madge says no.
I'm sorry, what?
Yeah, first of all, I wanted to just note that while miles traveled in the city are down 71% in the last few weeks, speed camera violations are up 12%. So people are driving faster and the streets are more dangerous. And there was a 2-week period in March when bicyclist injuries were had actually gone up despite lower traffic. I also wanted to propose an amendment, which is to the resolution, which is that from what Corey Johnson was saying, picking up on that, I think we need to broaden the resolution so it asks the city to also expand space for pedestrians. Our parks right now are getting overcrowded. There's no reason why our streets can't serve, given the slow traffic, and particularly on the Upper West Side, the cross streets serve as a safe space as well, selected streets. And we'd leave it up to DOT to decide how to structure that. I think we have to remember we're in a different time and this is not business as usual.
Okay, I'm going to call on Jay, who had his hand up, and then I see Jeanette has her hand up, and I'll keep looking for hands. Jay?
Yes, are you hearing me?
I am.
Good. I think, first of all, that I understand the impetus for this in terms of trying to help workers. Obviously, the reference to the mayor suggesting that people use their bicycles to go to work, I would suggest the mayor's prime objective would be to get people to stay home. So it's clear we're only talking about essential workers who are the only ones that need to get to work. It certainly would be helpful, and I understand the time constraints in knowing some statistics at all as to how many essential workers commute by bicycle, where they are, et cetera. And just anecdotally, I'm sitting here looking out a window on West End Avenue, and we've been sitting here for almost 2.5 hours. And if I've seen 5 cars go by, it's a lot. So I suspect that this is probably the safest time in history for bicycle riders to be going to and from various places by bicycle. I do have a question, this reference to infrastructure. Can somebody, one of the chairs, explain to me what you mean by infrastructure? And I admit I'm skeptical because, you know, my reaction is that once a bike lane, specifically a protected bike lane, which involves usually construction or infrastructure, is established, it's never going to leave. And the establishment of protected bike lanes warrants a much more extensive information and discussion on a case-by-case basis. So what is it that you're talking about when you talk about infrastructure?
I think the resolution is very clear. It says temporary infrastructure. It
So
means
what is
whatever.
that, Howard? What is?
May I jump in,
Just
Jay?
give me an example.
Let me jump in because the city is actually doing this and they're using highway cones. They're using highway cones and you know, those bollards and those flexible bollard things. Those I think they call them Boston barriers or something. They're using those kinds of things. It's stuff that they could remove the next day. It's not that the city's already doing this in some places.
Yeah.
And that's what they're using.
Well, in many places, those flexible bollards are in essence a permanent.
I misspoke. When I said
barrier.
flexible bollards, I meant those highway cones and the
Yeah.
tall ones.
Okay.
Anything else? I'm trying to move
Yes.
along.
Yeah.
Okay, go ahead.
No, this is a two-part resolution. And just as a point of information, everybody should know that within the last couple of days, the state budget was passed. And in the state budget is an authorization permitting the use of e-scooters and motorized bicycles, which has created a whole host of safety issues, usage issues. Can they go in bike lanes? Do they have to be registered? Are they subject to motor vehicle registration and insurance requirements? So I think this spills over into a resolution like this and warrants a lot more. The last thing I want to do is take up a lot of time with this. When I originally read it, I planned to offer a couple of amendments, but I'm not going to do that. What I would, however, like the committee to do is at least separate out the city bike reference in this resolution. For this board to try and pass a resolution encouraging more city bike installations and even support for city bike, I think it's totally inappropriate. There are a host of issues that I've tried to raise in the past in connection with parking issues, etc. But going back to the state budget.
I'm sorry, Jay, I'm sorry, I'm going to interrupt because you said that there's calling for more docking stations. The resolution does not call for more docking stations.
I didn't say it called for more docking stations. I say it's calling for support of city bike. And let me see the language.
It asks for the rebalancing efforts. That's what it says.
Yeah, and what is rebalancing? I'm sorry, I don't know what that is.
When bikes get ridden to work but don't get ridden home, they all end up in the Wall Street area. And so there are ways in which City Bike brings the bikes back to empty places on the Upper West Side. That's what we're asking them to do. They do it as a matter of course. We ask them to do more of it.
Okay, so what does that mean for us to support it? Just
write a letter saying, please do that.
It doesn't involve any financial support, as a couple of city council members have proposed in the past.
This is not that.
One of the things that happened in the state budget with regard to these e-scooters and motorized bicycles was an attempt by some organizations to get language into the budget requiring that the e-scooter and e-bike companies carry their own insurance policies. That didn't make it in. So what does that mean? And it also applies to City Bike. In this state, we have a vicarious liability law, which means a car owner, a truck owner, any kind of vehicle owner is vicariously liable for the operation of that vehicle. We don't know yet if there are any regulations for e-scooters and e-bike companies. What we do know is that if a City Bike renter, and by the way, any rental car company is subject to this law. If anyone in a rental car gets into an accident and is sued, that rental car company is liable. That's not the case with City Bike. There are no standards for City Bike renters. There are no license requirements. There are no educational requirements. There are no testing requirements. So that if a City Bike renter happens to run into a pedestrian and seriously injure them, and that pedestrian's only remedy is against that renter, which means two things. If the City Bike renter has a homeowner's or renter's insurance policy, then that's the target of a lawsuit. If they don't, that injured person is left high and dry because there's no requirement that City Bike as a corporate entity have any vicarious liability. I think that warrants a serious discussion of anything that indicates or implicates support or encouragement for Citibank. So if you want to lump these two parts of this resolution, I would urge a no vote. If you want to separate them, then I think the board should be given the opportunity to vote on them separately. I personally am going to vote against the entire resolution.
Okay, well, if
Because
that's
I
the
think-
case, then
I
I'm
think-
sorry, I'm going to move this along. Thank you, Jay.
Well,
I
Mark,
see-
you're moving it along. It's been over 2.5 hours and we're just doing board business.
Yeah, I understand, Jay, but we're talking about things that are not relevant to the resolution right now. So I'm trying to get us back to the resolution.
The City Bike is not relevant. The second part-
Vicarious liability is not relevant. I'm sorry. I'm going to call on Jeanette.
Oh, yes. I've actually, I understand the intent of this resolution. I've had to ride my bike quite frequently in the last couple of weeks because I'm the guardian of my father who lives over on the east side. I think the streets are very empty. I can ride the transverse road and not have a single car behind me. I think in order to have DOT come out and assess areas and determine where cones go, you're asking people to work who right now are needed somewhere else if there's restriping or such. I don't feel like this is really in our best interests given the current situation. And I think most of the people who are on bikes in our neighborhood, I know there's a couple of people who bike to hospitals and such, including my neighbor. But most of the people are delivering food and they are not going to follow a channel on a street that is otherwise empty of cars. So I would like to see the resolution separate. I do agree. I've noticed the City Bike stanchions near Mount Sinai frequently are empty. So I do think any support that we need, City Bike needs to maneuver those. And enforcement, I think, is important, but we also recognize that over 20% of the police force is out sick. And so we have, it's the current situation. I just don't want Community Board 7 to come off so much as privilege when other communities are really working on much more dire things.
All right, so if we were to
Mark,
separate the
I'm
two
sorry, but Mark, I have to correct you. You said that this resolution doesn't encourage any more City Bike docking. The first part of number 2 says work to significantly expand the number of available city bikes.
Yeah, the bikes.
So
The number of
city
bikes, not-
well, we're expanding the number of city bikes means that you have to have a place for them. And anything that encourages this arrangement with the city, in my mind, certainly shouldn't be voted on without an extended discussion of Citibank's liability, their contract with the city, their subsidies, and so forth. So I strongly disagree with that. If they want to take it as a friendly amendment to take out that sentence, then it would be consistent with what you're putting forward.
Okay. The chairs have muted themselves. I will just say this. Having more bikes so that the existing stanchions are not empty is what I understood the resolution to be. Howard, is that right?
That is totally correct. Less than half of these stations have bikes in them. So the goal would be to provide more of these bikes to enable essential workers to get around.
Well, then why don't you say to provide more bikes in existing stations?
Let's take that as friendly.
It's a friendly, yeah, fine.
I don't see any other hands, so I think I'm going to go on to the BCI committee unless.
Mark, can I just have just a point of information? How do we vote actually? How does the voting work?
I'm sorry, I mentioned that before, but maybe I need to be clear. We're going to take one vote at the end.
Right.
It's going to be a roll call. And what's going to happen is that I'll call, I or the secretaries will call Howard Yaris, and you'll say yes on all except for number 13.
Oh, okay. Okay, thank you.
Okay, so, and Jay, we might want to make note of that too, so that you can say yes on 1, no on 2. Okay, okay.
Thank you,
Rich,
Mark.
did you still want to say something?
Yeah, I just want to clarify that this was my proposal about City Bike. We're not talking about adding City Bike stations. The issue at the time of the meeting, which was as the outbreak was starting to take hold, was that people were riding City Bikes out of the district, and City Bike was not able to bring enough bikes back into the district for people to use. It's become that much more relevant now because to all intents and purposes, the subway is not a viable way for people to get around. I saw today that over 30 MTA employees have died from the virus, which is beyond tragic. And so we want to make alternative ways for people to get around the neighborhood, and City Bike is one of them. And to the extent that City Bike is not balanced, which was the wording of the inclusion in the resolution, making sure that there are an equal number of bikes in all the existing stations is something that's imperative. And what we wanted to get across was that this is outside the scope of what City Bike is intended to do with rebalancing. And if it needs city input and even city funds to help City Bike rebalance the bikes so that there are enough bikes for essential workers to get around and get to hospitals or get to essential places, the city should be helping them in that effort. It's not talking about creating new stations, and it's something we really should be doing, especially given that public transportation is so compromised. So I greatly disagree with what Jay is saying and urge everyone.
Whoops, okay, thanks. I see Robert, SBA, you're unmuted, go ahead.
Okay, yeah, I think that there's a very important and astute observation, this rebalancing business. And when I was a city biker a few years ago in the beginning, before I started falling and all of that from the arthritis, there was one of the features of the rental agreement was that for the renter to bring bikes from one station to another where there was a deficit, and which was very important. You would get a credit in your yearly dues or whatever. And I think that is the solution today. However, the problem is that we're sheltering in, so there's no one going out too much to get down to Wall Street, which is if that's where the bikes are amassing, and to get them up at the different parts of the city. So I think that the people, Richard and Howard, might sit down with the City Bike people and work out how CB7 can support them informationally. Maybe we want to have a dedicated meeting to that very soon. I noticed that at the beginning of the meeting, we had 120 people signed in to our meeting tonight. And so it is a very good resolution in that sense. I agree with Jay on separating the some of the components of the what is suggested by the resolution. So for example, the motorbikes and the scooters, just on velocity alone, I don't know how many times I've come close to being knocked over and I'm in direction. And you can't figure out if these scooters that are going fast and these bikes that are going so fast, how can they possibly stop if I step off the curb?
Can I just make a point? Those are illegal, period. They're
no,
illegal.
no, but here's what I'm saying. Howard, here's what I'm
illegal.
saying. I'm saying, Howard, here's what I'm saying. Listen to me. I'm supporting what I consider for this moment to be the important part of your resolution.
Great.
There is an issue, but it can't be dealt with in this resolution, and it has to be addressed because there's a question of not even injury anymore. If those bikes coming as fast as they're coming, and I'm walking very well, but a year ago I barely walk, and you step off, you just can't get out of the way in time. So there's an issue to be addressed with the Department of Transportation, with whatever that we might work on separately. But for now, I support the resolution, but I think you have to have a quick and, thank God for Zoom, because we have no excuses not to be in, to sit down with the people at the City Bike and say, okay, we want to go with you on this and we do support you. And this is what we see as the problem. And how can we help you through the different communications mechanisms that
I just want to say something quickly. Robert, I agree with everything you said. And what you're alluding to is there's going to be a pilot program for electric scooters, something that is illegal as of today, that they're going to be coming. And I definitely think they have to be integrated safely into the streetscape because they do pose a danger.
Yeah. So that should be a few.
In order to move on,
but not tonight.
In order to move on, I support this important.
Great, thank you.
Thank you. So that's a very fair point.
Balancing, I love that.
So that's a very fair point. Those electric vehicles should be the subject of a separate transportation meeting, and maybe there's a resolution that comes out of that. But that's not. We're not endorsing that tonight.
Right.
All right. Unless unless the chairs want to separate the resolution into two parts, which is up to you to do. No, we're not going to. So I think we're done with that. Right. So now we're going to move on to BCI. Linda, are you here? There you are.
Hi, Jerry should be here too. Christian, are you here? Christian? Okay.
Let me see if I can find him.
I'll look for him.
I unmuted Christian. Christian, you should be on as
I'm
well.
here. Yep.
Okay.
Okay, so
hi.
So we had number 3, which is renewals. Is the new applications for SLA licenses. In none of this, there was no opposition to any of this, and we approved them all.
Okay. Number 4.
Number 4 is renewal of an enclosed sidewalk cafe. Go ahead, Linda.
No, these were renewals, and there was no opposition.
Right, there's no opposition. Same thing with number 5, which is a renewal with a modification. They just modify the way they configure their space. So there was no opposition to this either. Number 6, a renewal of the enclosed sidewalk cafe. Again, there was no opposition. The committee approved it. Number 7 and 8 and 9, which are new on enclosed sidewalk cafes applications, they were all approved. There were no opposition.
I'm sorry, number 9 says a disapproval.
Let me see, hold on.
Wait, number
50 West 72.
No, it doesn't. No.
My
Hold
resolution.
on, I have my original notes. Let me just get them.
It is a disapproval. The applicant did not show up. That's correct.
Oh, okay.
Yeah.
So it's approve all except for the one that didn't show up.
Right.
Hold on a second, hold on a second.
I have my original notes. It didn't show up.
No, yeah, but that's 310, hold on. That was 50.
Yeah, that's 50 West 72nd Street. The applicant didn't show up, and because the applicant didn't show up, we had to disapprove it.
Right,
That's all.
now, we also had a 510 Columbus Avenue, which doesn't seem to be included here, hold on.
Yeah, there was a mistake on that. It says 310, 74th to 75th. It's actually 510 Columbus.
Columbus Avenue, correct, got it, okay, number 8, yeah, right, got it. Okay, so yes, so yeah, that's where we're at.
Yep.
What item number is 510, please?
Number 8.
8.
Yeah.
Okay. Anybody have questions on any of the BCI applications? Raise your hand now, please, either virtually or physically. I'm scrolling through. I don't see any hands raised. I'm going to attendees. I don't see any hands raised either. All right, so we're going to move on then.
Yep.
We're going to move on to preservation. I saw Kay a moment ago and now I've lost him. Michelle, are you here too? Let me go back to panelists. Maybe this is the better way to do it. All right, so Kay is now unmuted. And yes. Where's Michelle? There's Michelle is unmuted. So quick references to each of those applications.
All right. Can I just say something first, Kay? This goes to BCI. I have a list of, and this is on the issue of keeping the streets open for people now. I have a list of street fairs that start on the 14th of April. What happens if a producer doesn't have a street fair? Is that space still available? Can it still be closed off for people to walk through the streets of the street fair?
I'm sorry, Linda's muted, so my guess, Linda, let's hear from you. Linda, you need to unmute yourself. My guess is that without the promoter, the city wouldn't close the street because that costs money.
Right. Without the promoter, they're not going to close the street. But I think it's a moot point at this stage anyway, Michelle, because we're sheltering. So I don't think we can count on a street fair in April anyway. And by the way, I don't know if anybody's seen the Facebook, Mark Berkowitz and his wife Judy have tested positive for the coronavirus, and they are the producers.
Well, if you're in touch with them, please send them our regards.
I have, yeah.
Thank you.
Okay, so on preservation, Kay, you want me to do this? I'll do the whole thing if you want.
Go for it.
All right, the first item, number 10, is 119 West 69th Street. This is
Michelle, I'm sorry to interrupt, but just on the last point, the first wouldn't be happening. So it would be up to the city to repurpose the space for people to walk through. You know.
Okay, thank you. Thank you. So back to 119 West 69th Street. This is an addition on top of an addition in the rear yard. On a building between Columbus and Broadway, which is now empty. And the extension will not be different than anybody else's extension. And it is not correcting a mistake that the building owner may have made in the past. In other words, the current second two-story extension is properly within the 30-foot setback from the rear lot line. And we approve that unanimously.
Okay, that's number 10. Are you going to number 11?
If you like, yes. 240 West 73rd Street. This is the building across the street from the Ansonia on 73rd Street, 17 stories, 205 units. It is a rental building. They want to undergo renovation to the front facade, the canopy. They want to change the canopy They want to change what the outside looks like around the front door to be more consistent with the neighborhood and or the building. They want to remove all the air conditioners, put the equipment for the mechanicals on the roof for the air conditioning. To that end, they have to extend the parapet and
they're
they
building a
wanna
fence
put-
around it, right?
Pardon?
They're building a fence around it, right?
They're building a fence around it. It is visible, but this is on the 17th floor, 17 stories. They want to put the HVAC equipment up on the roof, and they want on the front facade to add a door. As you face the building on the left, there's a window there. They want to make into a door because that is a medical office, and the building wants the public to enter through the door on the outside and not through the lobby and then into the medical office.
Okay.
So
Thank you.
we approve that with the proviso that the facade 2 doors be glazed. And the applicant agreed to do that.
Okay. Should we go on to 117?
Sure. 117 West 79th, you're gonna like this. This is a building converted to low-income housing, does not have, it doesn't meet ADA standards now for accessibility into the building. The building owners or the project management has met with the Landmarks Preservation Committee. First, in an attempt to put a ramp as you face the building on the left, but they, let's see. I think they got into trouble with how much sidewalk space a ramp would take. Then they wanted to put a lift on the stairs in the middle of the building, but that would take too much of the sidewalk. So they're going to put a lift to as you face the building on the right. And the only, which everybody was enthusiastic about and the public spoke about enthusiastically, the entrance, once the lift is constructed, the entrance for the people that need the lift the entrance is in the lobby. It's not a separate entry. It's into the lobby as well as the same lobby that the people who are using the steps will use. And we just asked them to have the color of the lift. You can kind of see a white and black. Whatever color they choose, that should be the same color as the door, the design as the door from the steps.
Thanks.
Unanimously to approve that.
Okay. Going on to 311 West 90th.
This is a, hold on for a second.
It's the townhouse with the new door.
Yeah, I understand that, but I forget who lives there now. Is it, I don't think it's going to be just a private, yes, it's a private.
Single family.
One family. They want to comport that, they want the door to, they want to bring the building back to its historical 1940s design. They're going to emulate the facades of similar buildings on West 90th Street. The doors right now, the door to the building is 2 doors. They want to change that to 1 door. It's a little bit easier as we get a little older to open 1 door rather than 2 doors. And they want to change the current door, which looks like it's wood, to a glass with a metal metal design in grill in front of it. They want to also change door to the basement entry under the stoop of this building, which currently has a wrought iron door with where you can see that there's nothing to, they want to protect that area. So they gave us 2 proposals, of which we said they both are reasonably appropriate. And so we approved the changes to the front door and to the basement door with the proviso that they can choose whichever type of door they wish, because they are appropriate to the historical district.
Great.
We voted, that was 6200. And
And the final one?
finally, pardon me, yeah, finally, number 14, 42 West 94th Street. I forget about this. Can you take over on this, Kay? Because
Yeah, that was to do a rooftop and a rear yard addition. Yes, you can see the building highlighted there. That's the existing, that's what they want to do.
oh yeah, that's right.
We had quite a long discussion and took into account the rest of the donut in that particular location, and found that it was reasonably appropriate to what was going on.
This is a single family home also?
Yes.
Yes.
Yeah, this is a single family home also.
Okay, thank you. So I'm gonna look for hands that are, and I think I have one, Darnley Stewart. I'm allowing to talk. Please go ahead and forgive me if I mispronounced your name.
Hi, I think you got it right. Thanks. I'm the president of the board of the 9G Cooperative, which is 31 to 35 West 93rd Street. The 94th Street property would abut in the rear of our building and the common garden that we share. I guess my vice president of my board is also on the phone. He just happened to see this meeting on something that a notice that he saw on the tree. So I'm sorry, we're probably maybe a little late for this, because I understand that decisions were made at committee. But my concern is we've had a lot of infringement by Columbia Prep and Columbia Grammar already, and also including building up. And my concern is that the building upwards on the top of the building will infringe on the natural light of people who live in our building. So I don't know what our redress is at this point, or if we even have redress at the Landmarks Commission, but I just want to say I do have a concern about the building on the top, not the yard.
Yes, you certainly would have redress once the Landmarks Commission figures out, how they're doing these public meetings in our current situation, but there would be a chance for input with the LPC.
Okay.
Yeah, the Landmarks Commission is resuming its meetings, by the way. You should continue to go to their website on Friday afternoon, where they show both the plans and the times of the agenda coming up the following week. I see Jeanette has her hand up, so I'm unmuting and
Thank you.
Just a quick question. Can you show the slides, the before and after again of the last project on 94th Street?
I will try.
Okay.
Here we go.
Thank you, Mark.
I needed to undo that in order to be able to find the participants. So that's before, and that's the proposed after. You'll notice that the rooftop addition is not full width; it's about half width.
But are they bumping out the whole upper floors?
No.
Yes, you'll notice that there's an existing 2-story addition here, so it'll become full width and full height. That's what they're proposing.
And that's all as of right?
From a zoning perspective, yes. In fact, if you'll notice, the existing extension goes further into the donut. The proposed extension is less because they have to stick to the 30-foot depth requirement. I see Rich's hand raised. Rich, can you unmute yourself?
Yeah, so hard to tell from the picture, but it looks misleading, because my understanding is that the existing L extensions are 30 feet out.
Nope.
Or I'm sorry, that they're 15 feet out, 30 feet from the back of the
single family
from the back of the lot. And are they really shrinking the back so it's not going to be 15 feet from the plane of the rest of the houses?
Yeah.
this concerns me that it's a huge extension, and I'd put a lot of weight on the neighbors who are on this call and have been for hours waiting for their chance to speak. And this looks very, very similar to what I've been dealing with, which is just a monstrosity of an extension right next door in a way that I find incredibly inappropriate for row houses like this. And so I'm going to vote against, and I urge many others to do so as well.
Okay. I don't see any other hands raised, either on the attendees or on the panelists. Oops, Louisa, are you raising your hand? I see you doing it physically. Okay, go ahead.
Yes, I'm trying to.
Louisa, you're on.
I said what he
Can
was
you
saying.
hear me?
Yeah.
Oh, good. Sorry.
You hear
Okay.
me?
What Rich was saying, I think that, Mark, what you were saying is that the entire building is 30 feet set back, right?
The L extension is not, is deeper than 30 feet. The existing extension is further back than 30 feet.
Correct.
Okay, so that is correct. What bothers me actually is the extension, and can you be seen from the street? That wasn't mentioned at all.
No, there's no visibility from the street.
Shame. Okay, then it's legal, unfortunately.
But the question is whether it's appropriate. Jay, are you raising your hand? I'm sorry.
Yes.
Oh, there you go.
Just a question. How do we raise our hand electronically?
If you go into participants, if you click on participants on your screen, then there should be a raise hand function.
Not always.
Okay.
I'm not getting it. That's
well, I found you anyway. Go ahead.
Oh, no, that was my question. I just wanted to ask you just to unmute the committee members because we may have some quick answers to these.
Okay, thanks. Rich, all right, so are we done with this? No more questions?
Yeah, I just want to clarify that it's not just whether it's visible from the street. There's this whole issue that we've talked about many times about the donut and the many people in the backyard, and there are a number of criteria to view the appropriateness for people in the rear of these buildings. And just because it's visible from the street, it's not visible from the street, doesn't give you carte blanche to take over the donut and build something vastly inappropriate for houses in the donut. And again,
Rich, we have been improving these for years. This whole window wall in the back on the donut so that everything in the building can be seen by everyone across the donut. And we've been improving them.
Yeah.
Well, it depends how you define improving.
No, approving.
Approving.
Oh, okay.
Well, if I
think
may.
That doesn't mean we have to.
No.
Right. And
I think one of our considerations was exactly what the neighbors brought up, is that the school, I mean, you know, in comparison to what the school was allowed to do just a few doors down, this is pretty minor, but you can have your own opinion about that.
Yeah, I'll share quickly my thought, which is that it isn't appropriate because it's a full width addition that's also full height, and it shouldn't be full height. I won't go into detail, but that was my vote.
Mark?
Yep.
Doug McGowan, Paige Cowie have their hands up.
Oh, where there's Paige is unmuted. Please go ahead.
Hi, I'm new to this, so bear with me. Can you hear me?
Yes, we can. Go right ahead.
I find this is a very unusual block with Columbia Grammar. And that was new building on the north side of the opposite this building, and also a communal garden. We worked very hard with them over 10 years ago about how to structure and preserve the remaining facade that faces south. So to take this building off, put a glass facade, extend it, and as Mark said, change the entire configuration of the back of the building, to me just is way too much. And the top, I'm not convinced. I haven't seen the plans, but I think this sets a very bad precedent, even though modern architecture is back in vogue. Terrific, wonderful, but not this block. we need to at least keep some semblance of the original configuration on the south side. And that was one of the things we tried to do years ago when Columbia Grammar moved across the rear yards and built and joined two buildings together. So I'm with the camp on this one to encourage people not to support this. This
Thank
needs
you.
to go back to the drawing board. Thank you.
Thank you. Ken, did you have a comment on this one? I'm sorry. No? Okay, thanks. So any other questions on, oh, I see an attendee.
Doug McGowan.
Darlie, I'm gonna give Darlie Stewart another chance at this. Go ahead.
Yeah, just quickly, I guess I didn't understand when I first looked at the plan that it would also bring the building closer to our communal garden that we have at our building, and that's a problem for me. But also with respect to the Columbia Grammar, as unsightly as their development is in the back here, it did not go up, unlike their development on 93rd Street, which did go up and has affected our natural light. So to the extent that there's a construction on the roof, and I understand that it is set back and not taking up the full roof, it will definitely affect our natural light. So I ask that you vote against it.
Thank you. Just as a point of clarification, the facade will be full height, but it will actually be a little bit further away from you. But I think the point is made that I take your point either way. Are there any other questions about this or any of the applications? We didn't actually ask for comment on the other preservation applications. Any questions on the other preservation?
I think
Doug
McGowan. Yeah, I just
Hey, this is just a clarification question. The three of the identified discussion points that from tonight that we're talking about on the preservation committee were discussed at the last preservation committee on April 2nd. It looks like three of them maybe were discussed at a different preservation committee. Is that the one from February that some of us would have missed?
Yes. That was the one from
Or
March.
March, apologies. Okay, that's just a point. Okay, thank you.
Okay. Okay, so that's all of the resolutions on your sheet. Rich, did you want to offer something about the schools and the Zoom platform?
I do, and just very simply, and backing up what the CEC3 wrote in a letter, the schools have done a remarkable job, or at least my daughter's school, MS54, has done a remarkable job of getting up and running using Zoom. And the DOE kind of pulled the rug out from under all the schools and the teachers and the administrators and the PTAs and the students have done just enormous work to recreate a virtual environment and allow students to remotely log into classes using Zoom. And for the DOE to say just instantly that the schools have to stop using Zoom and have to switch to Microsoft Teams after all this effort, after everyone's figured out how to install the software and get things up and running, really is going to have a detrimental impact on education. And so I propose that we have a resolution just backing up the CEC, calling on DOE to reverse its ban on Zoom, encourage them to work with Zoom to address any of the privacy or other issues, but not make the schools change course after they were so great at getting things up and running so quickly.
Thanks.
And
I see Christian has his hand up. Christian, I'm trying to, you have to unmute yourself.
Yes,
Go ahead.
yes. Okay, so I do agree with what Rich said, except that you also have to take into account that, and as I understand it, we also experienced it where we were hacked by some Russians in one of the meetings. So the school system is very concerned with that, especially when it comes to kids. So that's the reason for the ban. Now, I also do understand that they're working with Zoom to try to get Zoom to fix those security holes so that they can go back to it.
So let's put that in the resolution. Christian, is that what you're saying? I'm not hearing you, Christian. Yes, okay, there's a nodding yes. Any
Yeah,
other
and I think
comments?
everyone knows that things are not perfect and everyone's working to make it better. But I don't think we can strive for perfection. I think we need to strive for what's some way to try to replicate the classroom experience. And for the schools that are using Zoom, I don't think we should call on them to instantly stop.
And I think we heard from the president of the CEC that the distribution and use of digital media is very much a socioeconomic issue that, and so pulling the rug out from under people at this stage will seriously disadvantage some folks more than others. I see Julian's hand. So I'm unmuting Julian. You may have to unmute yourself.
Yeah.
Go ahead.
I just wanted to completely agree with Rich. As a student in schools doing remote learning, I found that, it's taken a few weeks for everyone to get used to Zoom, and we've got to a point where teachers are comfortable using it, and students, especially those who didn't originally have access to devices or maybe didn't have the access to technology, have finally been able to use it. And at this point, by banning Zoom, it's taking the rug out from under people's feet, and it's preventing students and teachers from holding classes. And I know that the way my teachers are dealing with this is they're either continuing to use Zoom because they don't know how to use the other systems, which could pose privacy issues, or they're stopping their ability to do online classes, and so it's harder for us to learn. And so it'd be really great if the DOE could address this by resolving privacy issues with Zoom so that we can continue using it as a platform.
Thank you. I see Robert, please go ahead. You may have to unmute yourself. And I see Elizabeth after that.
Shelley Fine too.
Yeah, can you hear me? I think that I'm unmuted.
Yeah, no, you're good. Go ahead.
Yeah, I think we should strongly support the position that Richard just shared with us. It's almost silly to have the Board of Education put an embargo suddenly on the most important teaching tool that we've seen in a century. The society in total, thanks to COVID, is moving toward the remote buying, remote teaching, remote travel, and the whole thing. Not to mention that you're going to put a halt on education for the next, whatever it is. When is COVID going to go away? When's one of the teachers and the students going to be able to get back into their classes? Even if it's 3 months. So what happens in 3 months with these kids? What do they learn? So then if we're talking about Zoom, are we talking about Vimeo? Don't forget, they're more than one platform. Zoom happens to be the best one right now, okay? So that to put a halt on this is just silly, and it's a kind of self-sabotage, and it begins to, you question, who are these people running the Board of Education where they can be so short-sighted? What about our children? And I'm not even talking about the disadvantage, my Black and my Latino community. I'm not even talking about it. I'm talking about all children. They're all on there, okay? And the ones who are on there more than anyone else are the kids that are privileged because they've been to these places. So they navigate this all day long. And they have the best instruments. They have the best computers. They have the best smartphones and the whole thing. Education is a significant part of it is electronic. It's not necessarily in situ anymore. Okay, that might be something of the past. After we get all cured and healed and the whole thing, we've learned another way to do it. And then the example that I use to all of my friends in my other community engagement is that we're getting turnout at community board meetings that we haven't had before because you don't have any excuse. Now, I love to take a few block walk down to the main office on 87th Street, but not when it's 10 degrees outside and not when it's raining, okay? So then, I sit comfortably at home, and if I want to go grab a glass of wine over there, that the way Richard just has been doing all night, I got a glass of wine and have a good meeting. But if we're talking about disenfranchising children education, even in the short term, I think is immoral.
Thank you.
I would support
Thank you, Robert.
Richard and the CEC president on their position on this very vigorously.
Very good. I'm going to unmute Elizabeth. And I also understand that Doug Kleiman and Shelley Fine want to speak, so we'll get you. Elizabeth, you're next.
Yeah, I put it in the chat, but basically I've gotten a lot of questions today from people who are asking about this, and I've mentioned it to many of you. But the Chromebooks that students are getting, I actually think the bigger issue for our neighborhood is really the Wi-Fi issue. And I think we should, whatever resolution we do, I appreciate and understand that, distance learning is an issue for everyone, but we should not forget about the people who are most vulnerable and who cannot have access despite getting an iPad or a Chromebook. They can't connect. And that's a critical thing for our neighborhood, and it's been coming up a lot. So that's it for me.
So so are you advocating that we add to the resolution that we, I'm not sure what you're saying about Wi-Fi other than that it ought to be more pervasive. Elizabeth, can you speak to that? I think I just unmuted Shelley instead. Shelley?
Okay, okay. I do e-coaching with teachers in classrooms on a daily basis, and I have many family members and colleagues, and it's working pretty well. It was a steep learning curve for most teachers. It was a steep adjustment curve for the students, and to pull the rug from under them now, when they've begun to adjust and teachers have begun to refine their ability, including the ability to use the security aspects and ultimately, more important, the educational strategies, is really sad. To learn something new and hopefully that will be better. It may be better in terms of security now, but it may not be better in terms of what it can be done for learning.
Okay, thank you, Shelley.
And also, I agree very much with Elizabeth that I know many kids, because I work mainly in South Bronx, that the Wi-Fi is an issue.
Okay, so we'll add something about Wi-Fi to the resolution. We'll work on that. I had Doug. I see Christian after Doug, and then we're going to go Louisa and Robert. Those are the ones I have.
Okay, I just wanted to say I appreciate the Zoom platform, and I can only imagine how beneficial this is for the Department of Education. But I don't want people to underestimate the level of crime, child victims crime. We're talking about pedophiles, and I as I mentioned earlier in this Zoom call, I happen to be friendly with some of the foremost experts in the United States, and they are stealing identities. There's pornography. There's a lot of stuff that has to be addressed. It's extremely important, and I hope they can fix it with some of the security, with the new software downloads that are available. But we shouldn't underestimate that. It's a very serious problem.
Thank you. Who do I have next? Christian, I think, is next.
Yes. Yes. Okay. So, and what about the equipment issue? Even though the department meant well, they really have been horrible in distributing equipment. With the Chromebooks, one of the things that many schools did was, since they already had the Chromebook, they gave them to the students to take home. But the issue with that is, as Elizabeth pointed out, is that you have to have Wi-Fi at home. Now, the department was also distributing iPads with Wi-Fi built in.
Yeah.
But they haven't been very good about it.
Yep. No, that's absolutely right. Thank you. I'm sorry, I shouldn't be commenting. I'm calling on Louisa. I think you had your hand up. Is that correct?
Yes, but I think that Rich is I would like to know exactly what the resolution is, because this has come up and it's not written, and it seems to me that there are a couple of different aspects that have been mentioned. So what is it specifically that people would like us to vote on?
Rich, go ahead.
Yeah, so one question which Doug McGowan raised, this is not in the list of resolutions because it is new business, and the reason it is new business is because this just came up over the weekend, so it was too late to pass committee. But the issue is, over the weekend, the DOE announced that all schools need to stop using Zoom for remote learning. And this morning, the CEC3, which is the Community Education Council in our district, sent a letter to the DOE calling for them to reverse this ban, because so many teachers, principals, PTAs, and students put in so much effort to get things up and running in a very short amount of time to allow remote learning to happen in these extraordinary circumstances. And acknowledging that there are, like Doug Kleiman mentioned, there are some privacy concerns with Zoom, but Zoom is working as quickly as they can to address them. And forcing all of the schools to switch from Zoom to another platform, and the DOE suggested Microsoft Teams, would take a massive effort after the schools have already made a massive effort to get remote learning to happen. And so the resolution is calling for the DOE to reverse this ban, to work with Zoom to address the privacy issues, but in the meantime, to allow schools to continue using Zoom because it has been very effective, albeit with some challenges that under normal circumstances we would not want to tolerate, but we're in an extraordinary time. So understanding that there are some issues, but Zoom has allowed remote learning to happen in a way that's really extraordinary. And we want to make sure that continues and we don't disrupt it.
Okay.
Thank
And
you.
then there was the suggestion that we add a paragraph about equitable distribution of devices and ensuring Wi-Fi access as well. Is that part of it?
So I'm happy for that to be. It's not something I'm aware of. My understanding was that the 300,000 iPads that the DOE purchased and made available to students are equipped with cellular so that they work on the T-Mobile wireless network. To the extent that there are concerns with Wi-Fi or concerns with connectivity, by all means, that should be part of it. I just, I'm not up to speed on what those issues might be.
Okay, great. So I see Ira with his hand up, and then Bob SBA will go back to you. Ira?
Yeah, as you know, I'm usually the one who brings up procedural issues between CEC and CB7 and whatnot. And there are two things I see here. One is CEC itself did not write a resolution for some of the same reason that we may not be able to necessarily write a resolution. But if we could write a letter, then we could continue to write as this develops. As you said, as people have noted, there's a very reasonable chance that Zoom will correct this or may already be doing it momentarily. So can we focus on asking them to do that, and in the same way that the CEC has done, which then lets us use the same mechanism when CEC writes the next letter, we're in a position to quickly write a letter, and we could we in some way delegate that to Mark, particularly given his familiarity with the issues?
I'm happy to do it either way. Let's go to Robert. You're not muted, so go ahead.
Okay, I just wanted to add a comment because the security issue, of course, is an issue, but security issues is a lifelong issue. It doesn't go away. I mean, these same firms that they'll hack the Pentagon. So these are on parallel developments. So you have the advancement of these platforms, and then you have the intelligence and the aggressiveness of these criminal acts.
Whoops, what happened?
You have your own cadre, your own specialists that may be assigned by district that monitor all of the platforms, not just Zoom, the other ones that are being mentioned as well, and make the corrections and make sure that we have the firewalls updated and the latest in hacking prevention technology. And I think that in the resolution, we should call for that, call for funds for the local CECs to be able to assign a team of specialists that would address the hacking issue. But it doesn't go away. And again, I don't want to continue to show my impatience with DOE because I'm not an educator, but it's very ignorant. So if we switch to another platform, it's not going to happen with the other platform, is it? It's only these hackers only have an issue with Zoom. They have an issue. They attack any platform that is mass communication, that is reaching the greatest audience, and that's where the good guys come in and battle them. You know, it's the stuff you've seen some great movies on this very same thing. So
Okay.
that it's just short-sighted, and I'm just repeating that the risk comes with the advantages and the benefits of the platform.
Okay, thanks. So, Rich, do you care if this is a resolution or a letter? I'm happy to do a letter.
I'm fine with the letter as long as we're able to. My understanding was that if it's an issue that we haven't as a board weighed in on, we can't write a letter, which is why
So the
I raised
resolution
it.
would be that we write a letter with these points in it. How's that?
Sure.
Okay. So I'm going to end the debate here and we're going to start our roll call. So I'm going to go first just to demonstrate how this works. And then I'm going to, I need to close this. And then I'm going to call on my colleagues. Where is this? What's going on? I'm sorry. Give me 1 second. All right. So I'm going to demonstrate. So I'm going to call on Mark Diller and I'm going to vote yes on everything except number 14, in which I'm going to vote abstain. And those are your options. Yes on everything, no on everything, and yes, except. Okay. So let me see. Barbara Adler, are you still with us? I don't see Barbara.
Sue Schwartz has a question.
Okay, Susan, you're unmuted. Go ahead. You may have to unmute yourself too.
Mark, it might be helpful if you do one vote at a time. Like what? I know you want to do all of them, but it's hard to keep track of everything.
I'm not sure I follow.
We would be here all night.
Yeah.
Just number one, everyone vote. Number two, everyone vote, like that.
Yeah, I'm sorry, I'm not going to do that. I think this is going to be, I think that would take an awfully long time. That would be 14 roll call votes, 15 roll call votes. Try it this way. If it doesn't work, let me know and we'll go forward.
Okay, great.
Sorry.
Barbara's here. She can't unmute. I'll see if I can unmute her.
Go ahead, Barbara. Barbara, you have to unmute yourself.
Let's see here.
Okay, can you hear me?
Yes, thank you.
Okay, I'm voting yes on one. I'm abstaining on number two. Yes on everything else except for number 14. I'm voting against.
Thank you. Jay Adolph, I'm looking for you. I don't know why this isn't alphabetized. Oh, maybe it's under J. All right, I'm going to do it a different way. Here we go. Doug Kleiman, I'm calling on you.
I vote yes on all except number 8, which I would be ineligible, and 14, which I will abstain.
Thank you. Sarah Lind.
Hi, I am going to be voting yes on all, and I just wanted to, for Susan's comment, I just wanted to let you know that I am recording the votes, and this is definitely an easy way for me in terms of recording them. So just to put your mind at ease, we're getting it all taken care of. Thank you.
Thanks. Andrew Ridgey, I'm going in the order in which you appear on the screen rather than any logical order. Andrew Ridgey, please go ahead.
I am voting yes on 1, no on 2, yes on 3 through 13, and no on 14.
And on 15, which is the letter?
Yes.
Thank you.
Thank you.
Rich Robbins, you're next.
Yeah, I voted, so I'm basically finished now. This is.
Rich?
Yeah, so I'm voting yes on everything except 14 is the awful backyard extension, right? So I'm voting no on 14.
Yep, thank you. Who's next? I already got Barbara. Robert Espier, you're up.
On everything.
I'm sorry, say again, I'm not hearing you. I'm sorry, you're freezing up. Go ahead, try it again.
West 94, I think that's
Freezing.
Robert, you're freezing. Can you?
14. No on 14.
And yes on everything else?
Yes on everything.
Got it. Yes on everything, no on 14. Is that, shake your head.
His image is frozen.
Oh, for heaven's sakes. Okay, who's next?
Yes, that's correct.
Thank you. Shelley, you're next.
Yes on everything except for 14. No.
Okay. Thank you. Who's next? Louisa Craddock, where are you? There you are.
Over here. Okay, yes on 1, abstain on 2, yes on 3 and 4, and 5, no on 6. Then all yeses until 14, which is abstain, and yes on 15.
Thank you.
Okay.
Could you, and after you finish voting, could you please mute yourselves? I can't call on April Adams. Let me see, or Bob Wyman. Let me see. Catherine DeLazaro, where are you?
Yes on everything except for number 2. I'm going to abstain, and 15. I'm going to abstain.
Okay, thank you. Next is Christian. You have to unmute yourself.
Okay, I yes on everything, but number 2, I abstain on 2, no on 14.
Not looking good for 14. Okay, thank you. Let's see who's next. Oh, the thing is jumping around on me. That was Catherine. Cindy Cardinal. I think you have to unmute yourself, Cindy.
Okay.
Are you there? You are.
Okay. Hold on. I wrote it down. Okay. Yes on everything but number 2 and number 14, and abstaining on 15.
So it's no on 2, no on 15.
No on 2, no on 14,
14.
abstain on 15.
Got it. Thank you. Next is Doug McGowan, please.
I'm a yes on everything. I'm a no on 2. I'm a abstain on 15.
Abstain on 15. Got it. Thank you. Elizabeth Caputo, you appear to be next.
Okay, so I am yes on everything except for abstaining on number 2 and number 14.
Thank you. Doug. Howard Yaris.
I'm yes on everything except number 6. No on 6, yes on everything else.
Okay. Let's see. 1, 2, 3, 4, 5, 6. Okay, thank you. Who's next after Ira Michnick, you're up. I think you have to
Yes
unmute
on
yourself.
all.
There you go. Go ahead.
Yes on all. Yes on all.
Yes on all. Thank you.
Yes
That's
on
easy.
all.
Thank you. Let me see. Jay Adolph, I don't think I've heard from you.
Oh, okay. I thought you got me, but I am yes on everything except number 2. I am no. And number 15, I abstain.
Okay. Got it. Thank you. Oh, this is jumping around like crazy on me. Jeanette, I don't think we've gotten you yet. Go ahead.
Nope. Okay, I'm yes on everything except for 2 and 14, and then 15 I'm abstaining.
Very good. Next one I have is Jennifer Nitsky. You're up.
Hi, yes on everything, no on 14.
Thank you. Let me see. I think Joshua Cohen is next, please.
Yep. Yes on everything, abstain on 2, abstain on 15. Got it?
No, give me one more second.
All right.
Now I have it. Thank you.
Thank you.
Let me see. Julian, you're up. Julian, you have to unmute yourself too.
Hold on.
There we go. Sorry, I was taking a second.
Okay.
Yes on everything, abstain on 14. Abstain on 14.
Thank you. Kay Carpin.
Yep. Yes on everything.
Thank you. Ken Coughlin, you're up.
Hold on, you got to unmute yourself.
Yeah, I unmuted you, but you have to unmute yourself. Yeah.
Okay, I did. Yes on everything, no on 6, and abstain on 14.
Thank you. Clary Newell, you're here.
Hold on.
Clary, I think you have to unmute yourself because I tried and it's not working.
It didn't work.
There you go.
Okay, it did. So I'm yes on everything, but no on 2 and no on 14.
Thank you. Linda Alexander.
Okay, oh, boy, I'm unmuted. Yes on everything except 2 and no, and 14 and abstain.
Thank you. Let me see. Lolita Farron. Lolita, I think you have to unmute yourself.
Okay, can you hear me now?
Yes. Yep, thank you.
Okay, yes on everything except for 14, which is a no.
Thank you. Madge Rosenberg, please.
Just lost you. Just a minute.
No, you got it.
Yep.
Whoops, what happened?
I think you just muted yourself by accident. Hold on, I'm unmuting you. Madge.
Madge, you have to unmute yourself.
We heard you before and I think you muted yourself, so. There you go. Oh. Hold on.
Madge, you're gonna have to unmute yourself. Okay. I'm gonna let Madge work on that and I'm gonna call on Meg Schmidt. Meg, you have to unmute yourself.
I'm a yes on everything.
Am I
Thank you.
unmuted?
Yeah, Madge, we're back at Madge. Okay, go ahead.
Sorry. Okay, yes on everything except number 2, abstain.
Got it, thank you. Melissa Rosenberg. You may have to unmute yourself. I am not hearing you.
Okay, hi.
Melissa, are you there?
Oh, hi.
Hi,
I'm yes on all.
thank you. Let me see, where am I? Michelle Parker, did I get you?
Can you hear me?
Yes.
Yep, go ahead.
Okay. Yes on everything, but number 2, it's a no.
Okay,
Thank you.
thank you. Let me see, where else am I? Oh, this keeps moving around. Natasha Kazmi.
There we go.
Natasha,
Yes on everything.
thank you. Okay, who did I just miss? Paige Kelly.
Yes on everything except 6, 11, 14, I think. 6,
Are they no's, by the way?
yes, they're no's.
No on 6, no
No
on
on
11,
6,
no on
11,
11, and no on 14.
no on 11, no on 13, and no on 14. Sorry.
I got it. Okay,
Thank you.
thank you. Richard Ash.
I must be getting soft. I must be soft. Yes on everything.
Thank you. Okay. Robert SBA, did I get you yet?
Yes.
Yes, I did. Okay. Sarah, I did. Seema, ready. I haven't gotten you. Please go ahead.
Yes, I'm yes on everything, no on 14, and abstain on 15.
Got it. Thank you. Where else am I? Shelley Fine, did I get you? Yes, I did. Okay. Susan Schwartz, I don't think I've gotten.
Yes on everything, but no on number 2, 10, 13, 14, abstain on 15.
No on I'm sorry, number 10.
Number 2, number 10, number 13, number 14, and abstain on 15.
Okay. Got it. Thank you. Next one I have on the screen is William Ortiz.
I'm going to abstain on 2 and 14 and yes on everything else.
Did I do that right? No. Okay, thank you. All right. I think, according to my chart, I think I have everybody. If you didn't get called on, please raise your hand now, either physically or virtually.
Louisa.
Louisa, I thought we called on you. I'm sorry, we did.
I just want to thank Mark. I think you've done a fantastic job on a very difficult meeting.
You're very kind to say. We'll have it. It'll be a shorter meeting next time, I promise you. Thank you all. So I'm not seeing any more hands. So I will transmit the votes to the secretaries, who I think are keeping their own vote as well, and we'll compare notes. But it looks to me like all of the resolutions passed except number 2 and number 14. Looks like they did not pass. Now I promised that I would keep this meeting open. So I will call for an adjournment, and I will hang around in case anybody from the public wants to talk about any subject, as long as it's not, PG rated or anything like that. But my board members should feel empowered to call it a night, with my deepest thanks for all of your sticking with us and with all of the updates and so forth we received. I see Darnley Stewart, who I'm allowing to talk, and then just go ahead and exit the meeting as you will. I'm going to keep it open as I promised. Okay, Darnley Stewart, I believe you've got the floor.
Hey, Mark, I really, the members of the 9G Cooperative, which Betty Friedan and a really great group of people. We really appreciate the board hearing us and listening to our issues.
I saw a hand.
Mark, I just unmuted everyone.
Okay.
So
good.
Members of the public can talk. We just ask you to talk once at a time.
Yep, go ahead.
14 attendees, remaining 22 panelists.
And I don't see any hands raised, except Darnley Stewart again, who's already spoken, obviously.
Jay Adolph raised his hand. Bob Wyman raised his hand.
Yep. Jay, why don't you go ahead?
Just wanted to add my thanks. Tough job. Well done.
Jay, thank you. And I apologize if I got a little short with you there. It's my bad. Got Bob Wyman.
The first time.
Thank you. Bob Wyman, unmute yourself. I think I just tried to unmute you, but whoop, no, you have to do it yourself. Go ahead.
Yeah, this is totally gratuitous, Mark. I just wanted to say thank you for a great job. It's actually one of the more intriguing board meetings I've ever attended. Thank you.
Thank you. You're all being very kind.
Paige.
Paige, you are unmuted, so go ahead.
Just again, huge thanks, and also just to update, I am writing a little notelet to the to Penny and you about 91st Street. I've reached out to city planning. I couldn't reach Ethel. I'll try her again tomorrow, but I do think put that, if Seema's still listening, on the agenda, because I think this is going to be the state of things to come. Outrageous ways of expanding, building lots that cantilever over adjacent properties and parks. Wait for it to come over a park. That will be the next one. So thank you very much. Great experience. And my husband kept walking in and out. So that's what I do. Thanks a lot.
Thank you all.
Up on you.
Thanks, Paige.
Night night.
Good night. Thank you. Anybody else that want to speak on, hey, Mel, good to see you. Let's see.
I just unmuted Mel.
Thanks.
Oh, you have to unmute yourself if you want to
Yes,
speak.
he unmute himself. I'm not seeing any hands in the attendees either. And I'm gonna take it as a bet on a good beer that no one's gonna join us at 10:18.
You never know.
Good night, all.
Maybe
Good
we
night.
should be worried about it. Seema, while you're still here, I'm assuming that we're gonna have a land use meeting and then we'll be talking about 91st Street.
Yeah, I think that's our only agenda item. Louisa suggested that we postpone I don't know if can you hear me?
Yes, you're doing great.
Okay. Louisa suggested that we postpone the presentation by Moses Gates on the RPA study of NYCHA for next month, May, when people will probably be in a better time, sort of mindset for it.
Very good. You know that my view on this is basically that the committee chairs decide what they want to do with their meetings, and that includes whether to hold them or not. I'm glad to support any principled view on any of those things as long as we get our work done. So that's great. And I look forward to that meeting. You and I will talk about how to set up that meeting another time, okay?
That meeting is
great.
scheduled for a Jewish holiday.
Which one?
Oh, it is?
Yeah,
Oh, boy.
What's the holiday?
Passover,
Oh,
holy day.
Didn't we move? I thought we moved it.
oh, no, you're right. It's on the 7th day of Passover. Ooh,
Okay, well, we'll find another time.
okay. Thank you for bringing that up, Shelley.
I just hit me.
Shelley, you can do me a huge favor and email me that comment, because my brain is not going to register it right now, and I'll write it
Okay, I
down.
don't blame you for your brain or you.
Okay. All right. Thank you.
Hey, Mark,
Yeah, here I am.
I just wanted to double check your count on number 2 because by my count, it looks like it would pass.
9, 10, 11, 12, 15, 16, 17. I have 17 no's.
You have 17 no's? Wow. Okay, I must have.
Well,
done
I'm
that.
sorry. I have 17 no's or abstains.
Yeah, but then 19 yeses.
Is that the correct count?
Yeah, 36
Okay.
people voted.
Then that's the answer. I haven't tallied it up. It just looked like there was a lot of them.
Okay.
So forgive me. It looks like 2 may have passed. We'll compare notes. I'll fill out my spreadsheet. You fill out yours. I'll email mine to both secretaries. And if I'm wrong on any of this, you'll correct me. And otherwise, that'll be the vote. Okay.
If there are any discrepancies, it's all on tape.
True.
Yeah. And tomorrow I look forward to rerunning the entire 3 hours and 45 minutes of this meeting. All right.
Do it in slow motion, so it could be.
So, and speaking of which, Mark, I think you need to stop the YouTube. And
Okay.
we
How
can
do I do that?
Oh, wait.